That means stop doing what you're doing because you're causing yourself pain. But it's Sunday. Happy Sunday, September 14th, 2025. Back again on this train. Um, Unfortunately, somebody's reporting my videos, and I'm not even putting them on YouTube publicly for people to view. But it's saying something about nudity and sexual. They got nipples and titties and all kind of stuff all over YouTube. So I don't understand what they mean. I'm just laying in my bed sleep, not even sleep, trying to sleep. But I can't sleep with a shirt on because my temperature elevation is permanent and everybody knows this. I can no longer be cool, comfortable, and collective anymore. So I'm gonna keep recording because I have over two, almost 200 videos of this. I seen it the other day. Almost 200 videos of this. So, and none of them have a T-shirt on. So they take one and tell me I can't show it, but they didn't delete it. It's still there. I can still view it, and I can still download it or send it to whoever I need to. It's one of those with the sleep paralysis in them. And I'll make sure I highlight that video, and it's gonna get to wherever it's gonna get to. It's gonna get to whoever it needs to get to, and the rest of them aren't there. They didn't ban my other sleep paralysis video, and the one in the red is actually more violent. The one in the red is actually more severe. The one in the red actually lasted way longer than the one that they reported to get it the view from being able to publicly view it. But anyway, that's irrelevant because the other hundred some videos is in my YouTube studios, and whoever needs it will get it. Whoever needs it will get it. If you are here, you know why you're here. I'm not going through the whole spiel. Start from day one. I even have Gotham Lane videos, so you can start from Gotham Lane, so you can watch the evolution of my mysterious condition. How I went from you'll never see me sleeping without a T-shirt until after April 17th, is when I permanently had to take my shirt off and can never sleep with a shirt again. Um, and you can watch that progression from Gotham. You can watch how I slept like a baby all day long. Didn't squirm, didn't toss, didn't turn, never moved, never woke up overnight. I woke up in the morning and hit stop, saved my video. But now, you wouldn't even recognize me as a person when it comes to sleeping. Um, no medication work. The sedatives I take are designed to knock a 5, 6, 700 pound man on their ass within 15 minutes. It does nothing. I would take it and sit up for 4, 5, 6 hours before I actually do finally doze off. And when I do doze off now, I'm on sleep for 20, 30 minutes, and I wake. You notice I'm woken up every time. I can never sleep comfortably, cool, relaxed, and comfortable for one night throughout the night. I can't sleep from the time I take my meds, lay my head on the pillow, shut my brain down, turn it off, and go night night till 6, 7 a.m. the next morning, wake up to be productive and comfortable. It just won't happen. It won't work. So again, it's September 14th. I say that because it's significant. It may still be warm throughout the days, but at night, it's cold outside. We're waking up to 40-degree temperatures already here in Clarksville, Tennessee. So we still have the AC on because it's September. We're in a brand new home. The home is no more than 4 or 5 years old. That means the insulation is up to code, perfect. All the seals are still brand new and perfect. No leakage. I have two AC ducts in my room. You'll hear this in every video. Ceiling fan, an oscillating fan. Plus, sometimes I need a handheld fan because I cannot sleep with a t-shirt. I cannot even sleep with a blanket over my shoulders to cover. But you'll notice in all of my Gotham Lane videos, I sleep. Everybody sleeps like a baby that's coddled. Everybody everybody takes their blanket and everybody cuddles up, bundles up. I can't sleep like that, or I will sweat, and you will see the sweat dripping down my face and my neck. You will see my bed sheets soaked up. I can't sleep, even though it's 40 degrees outside. September, it's 2 a.m. AC still on, so the temperature inside the house is in its mid 60s. My family keeps that's cold For inside, that's freezing. If you were in this house, you would need sweatpants and a hoodie on, plus a blanket to sleep. That's how everyone else in this house sleeps, because they have to compensate for me, so I won't cook, overheat, and my brain won't overheat and overcook at night. They love me. They don't want me to die, so they'll keep it extra cold. Because I mean, when you get so hot and you overheat, you can only go so far. Once you get naked, there's nothing you can do, especially when AC and cold blasting air will not cool you down and make you stop sweating. There's nothing you can do when you get cold. That's why I hate being hot. Everybody loves winter because when you get cold, you can always layer up. You can pile as much on as you want to get warm. But when you get hot, you can't take your skin off. You can't take your hair off. You can't get more than naked to try to cool down. And the AC doesn't cool me down, so they compensate and keep it extra cool so I don't burn up. And I still burn up at night. But again, if you're here, you know why you're here. Roger Hill's Roger Hill and Samuel Slade. This brought Samuel Slade at 80 some years old. He had terminal prostate cancer plus congestive heart failure. The doctor told him he had both of these things simultaneously in his 80s. He had ED because of it. He started taking this, and within 90 days, he had no doctor's treatment, no cancer treatment, no oncologist, no medication. He just started taking this with Roger Hill, CEO of Momito. He went back 90 days later to his doctor and asked him, "What'd you do?" He said, "What do you mean?" Samuel Slade, your prostate cancer is completely gone. Not in remission, it's undetectable. We don't even see it. It's like you never even had it. Plus, your heart is all clear. It's not clogged or congested anymore. Your heart's perfectly healthy. He said it restored him from 80 back to his early 20s. That's how energetic and how good he feels, and all his health care issues gone. He doesn't even need Viagra anymore. That he can still do his thing without medication. He didn't take any doctor's treatment or see any type of doctor. I'm a Vanderbilt patient, 35, never been sick before, no pre-existing conditions. I've been taking this for Monday was 61, so 66 days now. Roger Hill told me nobody goes past 90 days. He said even when Vanderbilt University can't figure things out within the body and the brain and why it's doing something or what's causing the problem with the person, even though me being a long-term patient for the foreseeable future and until Vanderbilt figures it out, finds a diagnosis, guarantees a treatment that will work, I will be a patient of Vanderbilt just like those little kids in the hospital for years to come. When Vanderbilt can't figure it out, Roger Hill, he swears by this. I take it every day, 4 milliliters of the liquid by mouth, let it absorb under the tongue, 2 capsules, and then I also use the cream every day. I brush my teeth with it, I wash my hair with it, I do everything with it. So, he swears, even when Vanderbilt can't figure it out, I can't be medicated because my body reacts violently to pharmaceuticals. So even psychiatrically, I can't be medicated. That's why I start my Social Security disability benefits for me and my 14-year-old son. Roger Hill swears this will do it. This will restore me. Nobody goes 90 days with Mormito and does not see recovery or starts to feel better and eventually ends up at 100% back to recovery. People are told they have a year left, 6 months left to live. Even with all the doctor's treatment, all the medication, they're in the hospital, or how they start taking this, 65 years old. It cures their problem completely, just this by itself. Restores them back to being 18, 19, 20 again. And they're running around this earth like they never had AIDS, like they never had a heart attack, like they never had prostate cancer or cervical cancer. It cures it all. So he swears, even though Vanderbilt has not diagnosed me yet, Roger Hill says this will do it. So we'll see. Like I said, this is day 66. You'll see on all my social medias, only at all lowercase at MarkCharlesGautier lowercase I on all major social media platforms. You'll see this all over my TikTok, all over my Facebook, all over my YouTube, all over my Snapchat, all over my Instagram. Plus, there's other customers that ask me, do I want to join their lives and help them sell it? Samuel Slade will tell you all about it. Jackie John will tell you all about it. Kimberly Gaucher will tell you all about it. My son even refers to this. You know that oil you take every day, that dry earth? No more my talk. Yeah, 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 yeah. My nephews will tell you I take this every day. I keep it in my daily bag. I carry a bag around because it's got all my stuff in it. When I leave the house, it stays in my bag. That's how much I swear by it. That's how much I'm relying on this. And that's how much Roger Hill told me it will work. So if it doesn't, something happens to me. Holla at Sammy Slade, Jackie Jones, Kimberly Gaucher, Javion Gaucher, and Roger Hill. Let them know this is what I take all day, every day. What did you what? Absolutely nothing. So I think it needs to speak a little louder, a little more passionate about what I have to say. I got everyone else that's holding my physical traumas together. Even my psychiatric doctors are holding up my physical traumas and supporting me with that. But I'm guaranteeing and banking on this ability to clear me from my psychiatric traumas, my psychiatric reasons. I have the best of both worlds. So, you don't lost your resources in the community. You can't use your daddy's, my daddy's, mine, or your identity to go to your local hospital so you can recover, my friend. You need medication bad. You trying to get more Nyquil, got blocking it. You trying to get blueprints, got blocking it. You can't get no more benefits, you got blocking it. All your identities are being investigated and checked. So what are you doing right now, dog? Became my identity for me. So touch me. Roger Hill is going to be a part of my afterlife care. So now you got Roger Hill, plus all of my family, my sons, then you got Livingston, Newman, all of my doctors. You have Vanderbilt doctors that will be sued and involved. Because they gave me medicine that didn't work. Haven't given me an x-ray. That's a lawsuit. Medical malpractice. Did your loved one die as a patient of Vanderbilt? Yes, they gave me medicine. And it didn't do anything. He still died from it. Because I haven't been diagnosed, it's not a benefit to you. That just means I'm going to be a patient of Vanderbilt until they do. That's all that means. Especially maintaining the physical shape. As long as I complain, that's all I gotta do is talk about it. And it's documented thoroughly every day. So if you keep fucking with me, I'm going to step up my therapy so it's documented with the government, the SSA, office, everything, every single day of my life. It's an everyday thing. So I have to decompress every day, multiple times a day. Because I can't be medicated. And this is why. If I could be medicated, I wouldn't be on withdrawal, wouldn't have stomach pain, my back wouldn't hurt, my head wouldn't hurt. I wouldn't be overheated, I wouldn't be in pain. And I wouldn't be psychiatrically insane. If I could be medicated, my face wouldn't be clogged, I wouldn't be overheated. You know what I'm saying? My eyes wouldn't be dirty, and I would be sweet, like a baby. If I could be medicated, I could take my powerful sedatives, I'd be knocked out 15 minutes or won't wake up to 6 a.m. I'm recording this shit, fucking with the idea of what it is. record and track record of me, my history, my life, my daily activity, my innocence, what I do, my son, and what I'm going through. Who I'm going through with, who's treating me, all this extra shit, the people in my corner, you're not one of them. There's so much record of it, it's impossible to steal my shit.
I can tell you right now, if you try to go back to your shift, you may not be there very long.
Even though her patient's EKG reads normal, Dr. Carrier believes he could still be having a heart attack.
My gut was telling me this guy is sitting up for a heart attack. And it's like your antennas immediately go up. You watch for sweatiness, you watch for them to be nervous, you watch your monitors. You're kind of taking in all this, and I definitely had that feeling that no matter what he's telling me about how great he feels, he's in denial. This looks to me like it could be bad. We need to do more tests.
Think we should get back in that bed, partner?
What kind of tests?
We need cardiac enzymes. You may be having the type of heart attack that doesn't show on an EKG. It's a partial blockage of the artery. If your heart is damaged, we can see it with the cardiac enzymes. The cardiac enzymes are basically chemicals that we find in the blood. When the muscle gets damaged, of course the heart's a big muscle. And when the muscle gets damaged, the cells release these chemicals into the blood.
Still think it's a sausage biscuit. I mean, starting to feel better.
Well, we're glad you're feeling better, but we still need some answers. His whole gestalt was of a person who's completely in denial. Hank, is there any family you'd like us to call? Are you married?
Yeah, but my wife's a drama queen. She'll make a big deal out of nothing like she always does. Besides, she'll probably be out playing tennis, won't like being interrupted. Well, I hope the station doesn't call her.
Well, I really want you to think about it, because in these situations, sometimes it's good to have family here. He seemed really disinterested in that, and some of that, I think, was him not wanting it to be real. It's part of the denial.
So how long you been doing this, Doc?
Oh, about 20 years.
The patient's wife is here.
Yep. Looks like they called her. Oh, boy.
Baby? Oh my God, are you okay? The captain told me you were here.
It's just a darn sausage biscuit I ate running after a perk.
Sausage biscuits, honey, you know those sausage biscuits aren't good for you.
Yeah, I know, but the kid thing came out normal.
So he's okay?
Well, he's right, the EKG was all right, but he still has the symptoms of a heart attack, and we're waiting on blood work.
Heart attack? He's sitting right here talking at us.
Well, the symptoms were chest pain, sweatiness, and it was very sudden.
Hey, what is she doing here?
We're on duty together. She drove me here.
Yoo-hoo, officer. You can go on home now, honey. This here is a private matter.
God save me. Put her down.
Baby?
He's crashing! He's crashing! We need help in here!
Our young patient is now bleeding from both ends.
This is right. You're making it worse.
He doesn't know what it is at this point, and I don't know either.
No, you all need to leave him alone.
Dr. Flowers' patient has a shovel impaled in his groin.
Who are you?
And an unexplained visitor.
Who the hell is she?
I'm Melissa.
She had nothing to do with this guy. She wasn't on the roof, and I'm pretty sure that wasn't her shovel.
Honey, I just... Were you with him when he was injured?
Yeah, we just met. I don't know who she is. I'm Dr. Flower.
Karen. She's white.
That's Alyssa. The patient is just wheeling herself all over the emergency department. Would you please get her back to her room? Hi. I'm not so sure if the wife bought the whole story, but at least for now, we got the dancer headed back to her room, and we can focus on the patient's more significant injuries. I can't imagine what kind of problem we have.
How did you hurt yourself?
I fell through.
Jay, how many times have I told you I don't want you going up there? What did he do to his arm?
Probably broke his elbow, but we're about to take some x-rays. Too bad we have to fully stack his injuries.
You're lucky you didn't crack your head open.
Initially, the patient's wife only noticed his arm. There was so much going on in the room and so much commotion, she didn't notice the shovel. Karen, can I talk to you? All right, thank you. Bye. I'll call in, sir. his show. You know, there is nothing in the textbook that tells you how to break news like this.
Ken, Jake's elbow injury isn't his only injury. So when he fell off that roof, he landed on the handle of the shovel, impaling himself.
Where?
In between his legs, in his perineum to be exact.
I described the injury to you, but nobody's prepared to see the shovel in that location. The picture's worth 1,000 words.
Get out, right now.
It was a really scary sight.
Do something.
Doctor, Buddy's patient has suddenly gotten worse. He's on the side of the bed, hunkered over, half off the side of the bed. He's got the nebulizer mask on and really breathing hard. What happened?
We gave him the nebulizer. He just got worse.
John, you have to calm down a little bit. Really, just try to take some slower breaths. You're still breathing way too fast.
Is he choking? John, sweetie. Can't you do something?
Fiance is getting very upset right now, and her demands are increasing. Listen, we're doing what we can, Kim. You have to let us work here.
Help him, he's choking.
I understand that she's very concerned about him, but she's actually beginning to block me from the patient with all of her protective maneuvers. Jack, you want to try suctioning? As we're talking, John fixes the situation himself. Out comes this big ball of bloody phlegm. I'll get that. Can I get specimen cup, please? I quickly grabbed a specimen cup and scooped it up to send it off to the lab.
What is that? Why is it all bloody?
So now the fiance is very upset. She brought in her husband-to-be with abdominal pain, and all of a sudden he's wheezing and coughing up horrible things.
This isn't right. You're making it worse.
Listen, Kim, just cleared his airway. That's a good thing. Meanwhile, John's looking better. Cleared his airway. Danny, we didn't have the blood pressure.
No, you all need to leave him alone.
The initial goal is to keep family members and friends in the room. It's helpful to the patient, but sometimes we can't. Kim, you just come out in the hallway. It was at this point that I actually had to ask his fiance to leave the room. Come on out there. Listen, these kind of emergencies happen all the time. This is what we do here. We take good care of them. You'll be okay. For a little while, I need you to stay in the hallway, okay? So we can just work a little bit more. John, what's going on? What's happening? So, it's okay. You know, these things happen. People cough bloody things onto me all day. It's not a big deal. It's not bad. It's a little worse. He's almost in tears. What's happening? And sure enough, he has proved himself, but this is kind of concerning because it is a large mass of bloody stool. My young patient is now bleeding from both ends. He's terrified. He doesn't know what it is at this point, and I don't know either.
Baby! He's crashing! He's crashing! We need help in here!
Dr. Carrier suspected her patient was having a heart attack. Now it's gotten worse, and he's gone into cardiac arrest.
All of a sudden, I see on the monitor he goes into a rhythm called VFib. If you've ever seen it, you'll never forget it. The heart is beating, but it's basically vibrating. It's not actually producing blood flow.
Get the VFib pads on him as quick as you can. What's happening?
It would be sudden death if they didn't do something about it.
Oh my God, is he dying?
So the brain's not getting blood, the heart muscle's not getting blood, the heart's just kind of sitting there like a bag of worms. Hurry, we're gonna have to shock him soon. Well, when this happens, it causes something like a seizure.
I need help in here.
This man was so muscled up and so big that when this happened,
Stop! Hurry!
his arms came down, got my nurse's hand with the pad in it stuck.
Hurry, get her free.
What I wanted to do was push the defibrillator. I couldn't, because here's this patient crashing with VFib, but if I shock him, it'll shock me too.
Hurry, get her loose any way you can. We've got to shock this patient. We're going to lose him. Yeah, he's dying.
And it was really frightening because I knew exactly what we needed to do. She knew it too, and she's stuck there. We actually had to get somebody to come in and get her loose before we could shock the patient. By which time, the VFib has deteriorated to a flat line. It was really scary.
Why aren't you helping him?
Seconds seemed like minutes, seemed like hours. It just seemed like it just drug. It was like in slow motion.
He's dying. Oh my God.
So we're frantically working to free her arm, which we finally do.
Clear.
Okay, everybody clear? Go
Everybody clear? Chuck.
My nurse, she was very experienced. And I remember her rolling her eyes at me like, what are you thinking?
My God. Doctor, we need to do CPR.
I just didn't think his heart was dead. I just didn't believe that.
Doctor, we have a problem in the resuscitation room.
I can't imagine what kind of problem we had. I assumed it was one of the other resuscitation rooms, not one where somebody has an ankle injury.
No pulse. We need some help in here.
Dr. Holmes' patient is bleeding from both ends, and he can't figure out why.
Danny, we're going to have a specimen cup. And let's get the curtains closed, please.
He had two major systems involved, his lungs and his GI system. First thing that runs through my mind is he has some sort of a bleeding disorder. Very bad things, such as DIC, disseminated intravascular coagulation. Now, it's a type of sepsis some people die from can cause this.
What's happening?
John's having a little bit of a tough time here. There's a couple more labs we need to send down, but don't worry, we're taking really good care of him.
Can you send that down to the lab, please? It'll take off in just a couple minutes here. I head down to the lab, check on some of the results. I'll be back. Should be okay. As I'm walking down the hall, I hear coughing.
So I head back into the waiting room.
Hi. Hey, Doc. How's it going? I was going to ask the same about you. Are you a family member? Oh, my brothers.
We're in a fraternity, and that makes me even more suspicious. So I want to know what they're getting up to here.
Dale, is this some sort of hazing?
Chuck.
Dr. Carrier's patient is in cardiac arrest, and his heart is not responding to electric shocks.
Doctor, we need to try CPR.
I know his heart's not dead, even though, like I said, he had just recently been dead, he was flatline. I really felt like we could save his heart with a shot.
Okay, go to 200 tons. Everybody clear? Chuck.
We got a rhythm. It worked.
I got a pulse. I'll take a BP. Hank.
Daisy, why don't you bag him? Help him recover? Thanks, gentlemen. Good work, Kathy. Are you okay? You need a break? Okay.
We need to call a STEMI.
A STEMI is a ST elevation myocardial infarction, which is your classic heart attack. It's the acute one that you want to get him right to the cath lab. We're giving him some medicine to help him recover.
Is he gonna be okay?
The best thing and the best outcome for someone like that is for them to get into the cath lab as quick as possible. I think so. Thanks to this partner right here who made the right call, dragging him to the ER. Get that catheter in there and open up more vessels that have been clogged by little clots, because that's what's going to save their life in the long term.
Doctor,
Yes,
cath lab's on the line.
he had a brief period where his brain was not getting oxygen in circulation. So the brain itself just kind of shuts down. Look at how high his troponin is, and that's before he even arrested in the ER. Okay, I'll have him ready for your team. Then very suddenly, he wakes up, comes right up off the stretcher, and I mean, he is swinging everybody. He's throwing his IV around, he's punching at the nurses, he's very confused.
Wait, we're just trying to help you.
He's almost in kind of a rage. It's almost like a defense mechanism.
It's okay.
You know, when an animal doesn't understand, you're just trying to help them, but they try to bite you.
Just calm down, calm down. Oh my God, why is he screaming at everybody? The president!
The wife of Dr. Clower's patient has just realized the extent of her husband's injuries.
Get out! Get out! Right now! Do something!
Honey, calm down,
Whatever you're gonna do, anything!
Karen, we're doing all we can to help Jay, and I assure you we're making him comfortable. We can't pull the shuttle out right away without first assessing the extent of the injuries it's caused internally. When you see an impalement, you want to remove the object right away. What a lot of people don't realize is that offending object might be pressing on the blood vessel, stopping bleeding. up for just a minute so we can get those x-rays?
Jay, I'll be right back.
We started to take the routine x-rays to make sure that there weren't any other injuries. And I hope we don't find something devastating. I cannot imagine what the level of fear would be for a patient with this kind of injury. You can see the pain in his face and the pain in his eyes. All right, Jay, you're doing great. We'll be right back after we get a chance to look at those x-rays.
All right.
Wow. The lumbar spine looks good.
Yeah. And no free air, so hopefully it hasn't perforated anything.
Well, regular x-rays are a good start, but a plain abdominal x-ray gives you a little information. It might show some free air inside the bowel, which means you perforated something, but you can't see all of the internal organs. You need a CAT scan for that.
So you can just take it out and you'll be okay.
I'm afraid it won't be quite that easy.
So until we get a CAT scan, we're not going to know how serious his internal injuries are.
Jay's going to require surgery. And during removal, we're going to have to repair any damage we find.
It is possible that when they try and pull this thing out and remove it, he could bleed to death within seconds or minutes if there are injuries to the liver, the kidney, or other organs that have a lot of blood vessels.
I know you're gonna be just fine. Stay strong.
I'll try.
Okay, let's go.
Doctor, we have a problem in the resuscitation room.
I can't imagine what kind of problem we have. I assumed it was one of the other resuscitation rooms, not one where somebody has an active injury. She's laying there flat on her back with the defibrillator cables out and the paddles laying on the floor. No pulse. We need some help in here.
We were sworn to secrecy, so I shouldn't even be saying this, but Lisa, let's get Dale to bay 3.
This is it. One of those moments you'll never forget. Celebrating a true milestone with the people you cherish. Everything is perfect, but it almost wasn't. That's where we come in. We're Lee Company. We'll be there when you need us most. To make sure all your life's moments are ones to remember. We want you to focus on living your best days in your home. Don't worry. We'll take care of the rest.
Life is short. Treat yourself.
Jim.
You're a lucky man. We 3 women who have come to Rome to star in their very own romantic comedy. I feel lonely in town. This is a real life fairy tale.
Ready?
Who needs physics when we've got chemistry?
I'll look at you talking like that in front of my wife.
she says it's a fluke.
Wait, what's a fluke? You're telling us it's a lab error?
And she says, no, the patient's problem is flukes. He has flukes. She says, I haven't seen this before, but we found lung flukes in both the sputum and the stool cultures. This is unusual.
Hey,
Sometimes it's just easier in person. Check the fact.
Lung flukes are an organism that's carried in a reservoir host, which would be something like a frog or a salamander or a crayfish.
Sorry, the time of that.
oh, that thing is huge.
But they are transmittable to human beings. If you eat them, they go in to the GI system, and they typically set up lodging in the colon. And after a period of time, they burrow into the colon wall, and that's what causes the abdominal pain.
This is in their life cycle.
Holy cow.
After a few more days or weeks, they mature, migrate further into the capillary blood system of the colon, and get distributed throughout the body. They are most commonly filtered out through the big filters we call our lungs, and get into the airways, and that's when they get coughed up and spit out. That sputum contains thousands, millions of these flukes that can move into the waterway, back into the next host.
Thanks so much for this.
So now I'm getting back to the room. I've got a lot of questions for John.
Did you figure it out, Doc?
Do you know what's wrong with him?
I think we do, but I'm gonna need a little more information from you before we can really figure out how to treat this.
Go for it.
Well, your pulmonary or your lung and your gastrointestinal system are both infected with a parasite known as flukes.
Parasite?
And I just start peppering John with questions. Have you traveled anywhere unusual recently? People travel to third world countries and they'll eat contaminated food or raw food. Did you eat at a new sushi restaurant? Anything unusual go into your mouth? And he's just not looking at me.
Sorry, Doc. No.
Sweetie, there's nothing you remember? You must have eaten something.
He's not answering my questions with more than a nod or a shake of his head. And I can tell you, he's holding something back. He just doesn't want to tell me. And in my experience, when a patient is anxious and worried about their medical condition, they're usually locking eyes with me. They're paying attention to every word, and they're trying to give me as much information as they can. He's not doing this, so his behavior is not what I would expect. While all this is going on, I'm glancing over to get a little assessment from the fiancée, maybe to confirm as he speaks. I'll look at her and try to see what she's doing. Most of the time, she's shaking her head.
You know, John, your cough. This is a lot like Dale's cough. Is there something you guys aren't telling me?
Dale?
She says, I knew it. It's gotta be these guys. He's pledging this fraternity. They're always doing these stupid things.
You want to tell them if you ate something.
But this is part of the hazing process. Who knows how many more could be infected? I had to confront the fraternity guys.
Hey, guys. Friend John here is really sick. He has a parasite in his body. In order to properly treat him, we have to figure out how it got there, and I think you guys might be able to help. So if you have any information, this is the time to bring it out.
Just then, in the midst of all their silence, we had another emergency on hand. And I thought to myself, this can't continue. I need an answer.
Dr. Clower has just found his patient with an ankle injury,
No pulse. We need some help in here.
unconscious on the bed.
She's unresponsive. She's not breathing. Check her pulse. No pulse. Let's get her position better on the bed at the count of 3. 1, 2, 3. Let's get her hooked up to the monitor. Go ahead and start her IV. I need somebody to start CPR, and I need the intubation tray. It's so obvious what happened. We're not even worried about considering whether she slipped or not.
Still strap?
I'm not sure how you get to the position to put the paddles on your chest and discharge them, but she did. She had 2 burn marks on her chest. Normally when we use electricity to restart somebody's heart, we use gel pads that go on the patient's chest when we use the paddles. Apparently, she didn't know about this.
She's AFib.
Because she's in ventricular fibrillation. All right, let's go ahead and defibrillate her. Charge up to 200 joules, which is almost a complete standstill and completely disorganized her. But in a young, healthy person with a young, healthy heart, it's also easily reorganized with defibrillation or electricity. All right, when I'm clear, shock her.
Sinus rhythm.
And she went right starting to wake up a bit.
Unbelievable.
Looks like we'll hold on the intubation for now. But let's go ahead and start normal saline, 250 an hour. But you call the ICU to make sure they have a bed available.
Okay.
Did you know if that ankle X-ray came back yet?
I'll look into it.
And non-displaced fracture, just what I thought.
Should we fit her with the boot?
Yeah, we should. Did you get an ICU bed?
ICU's full. She gets to stay here with us.
Melissa never needed to be intubated. And by the time a bed became available, she was almost back to normal. All right, Alyssa, we're going to go ahead and get you moved upstairs and watch you overnight. Hope you feel better. Cute.
Let's roll.
There were no cookies sent to the emergency department, no thank you notes. No backstage passes or any other form of gratitude. Sometimes it's a thankless job, but it's always gratifying. A couple days later, I went to check on the John Wood who was impaled by the shovel. Hi, guys.
Hi.
I just wanted to check on Jay to see how he's doing.
I'm pretty sore and I have a lot of stitches, but Dr. Cerner said that the surgeon went well.
It took hours to remove that shovel and ensure there was no bleeding, but he came through it fine.
Thank you so much. Yes, thanks, Doc.
You are very welcome. Jay, have you given any consideration to hiring somebody to finish that report?
Karen's already made the call.
You betcha.
You're in serious trouble.
So what are the sausage biscuit, huh?
What you people do to me? Dr. Carrier's confused patient is attacking her staff as he comes out of cardiac arrest.
So we're having to tackle this great big guy, hold him down, get the IV restarted, get him to pull that out, and then give him lorazepam, which is a tranquilizer, just to try to calm him down. During the period of time where we were trying to tackle him back into the bed, the cath lab team shows up. This guy is the one you guys came for, the one with the MI, is now your patient. Of course, we did get him calmed down before they took him. Okay, let's get the pads back on just in case. Listen to me, Hank. You're in serious trouble. Another episode like this, and you won't survive.
What the hell happened to me?
You had a cardiac arrest, your brain didn't get enough oxygen?
So what are the sausage biscuit, huh?
No. And these nurses here are going to take you down to our cath lab where they're going to put a stent in your heart. It's a procedure where they go in first with a balloon, blow the balloon up. That opens up the vessel. Then they pass a metal wire-looking device that helps open the blood flow to your heart. It stents the vessel, in other words, it holds the vessel open, hopefully on a permanent basis. If this doesn't work, you'll have to go to bypass surgery. Good luck to you, Chief. Let's go. Right around the time that they were doing the cath, he had another V-fib. Of course, they were ready and they just, jump back, shock him, and go back to business. They're kind of used to that. That's not unusual for a person to have an abnormal rhythm when you're in there kind of grunting around in the heart vessels with a big catheter. So it can, just the catheter being in there can actually stimulate the heart into the wrong rhythm.
cautious, I'd still like to know how the parasite was ingested. Well, we were sworn to secrecy, so I shouldn't even be saying this, but I did swallow a live frog. You swallowed a live frog? What do you need a frog for? That's how to get into this fraternity. It's part of the rule. You have to swallow a live frog to become full brother. So I did.
5 other boys had the same infection, and because we got this answer quickly, we were able to treat them before they progressed to the level of severity that John did.
It's looking a lot better. I feel like such an idiot. College, it's the time to be an idiot, right? But seriously, your honesty saved us and your friends a lot of trouble. Thanks. Although something tells me I'm about to be in a lot more trouble. Hey guys. Hey, look. Sorry I broke a crap promise.
Yeah. I was surprised you talked.
If Delta Tau Beta Kappa never wants to see me again, I get it.
No, man, the opposite. It took guts to talk.
Apparently it's working for something. If you want me to stop telling
Welcome
people about
aboard,
it.
bro.
So no, that's exactly what I'm gonna do. The opposite of what you're saying what you do. I'm gonna get exactly the opposite of what you want me to do. That's the way it works.
And just like that, I experienced my first fraternity initiation. Although
I'm
folks
traumatized.
caused some pretty dramatic symptoms. Pretty easy to kill with a single dose of
Chronic
antibiotic.
PTSD is
Eventually treated all those who needed it, and they were all fine.
gives me nightmares and flashbacks and
You know, it's lucky they switched science and
what's the
college.
use of
What's that?
Because
talk about that?
somebody has to rescue people like that. Might as well get a nerd.
what you
Thank you.
mean.
Thank
My name's being used, it's taken. It will be for decades. Talk to your community. She'll help you. Tell them what you're really doing with you. What do you do?
Your goals become easier to reach.
Take proof.
Always by your
See
side.
you from there.
Your BFF is ready with so many ways to help you save.
I'm gonna ask you why.
And by offering suggestions.
Right?
Your new
I'm
financial
gonna
plans can help you get where you want to go.
you put my shit on, DPFS thing.
Well, as experience, your big
They probably
financial
put
plan.
some for stuff.
This is it. One of those moments you'll never forget.
I'm gonna
Celebrating
fucking
a
take
true
this.
milestone.
Why you
You
doing
can
that? Just like
cherish.
a future.
Everything is perfect, but it almost wasn't. That's where we come in. We're Lee Company. We'll be there when you need us most. To make sure all your life's moments are ones to remember.
Because I got
We want you to focus on living your best days. Don't worry. We'll take care of the rest. The only way this works is if we trust each other.
Gorgeously gorgeous.
You fuck with my heart. You not like the good thing that comes with it. That's exactly what's it. You want the party raised. I pop the stitch. I pop the stitch.
nice, very kind lady. Happens to be a little bit, as we say in medical field, gravitationally gifted.
I understand you're having somewhat of a toe problem? Yes, I dropped a dumbbell on my toe 3 weeks ago. I was just following the advice of my doctor to start the resistance training, but I got carried away.
So, I didn't want to come in right away, and actually it was fine. I mean, my toe got big and flat and swollen.
Is it getting worse then?
Oh no, it's a lot better.
Okay.
But you could tell that she really couldn't reach down to get down to her toe.
It's just I got so fast.
Oh. Good news. We can take care of this, okay? Just give me a second. I'll just put on her gloves.
Okay.
Okay. Listen, I'm out of gloves. We'll be right back, okay? All right, hang in there.
So, what's the deal? Do you actually have a prank plan? No. I just wanted to make him paranoid.
Please.
Doctor?
Not interrupting anything, am I?
No. No, working, busy, saving lives.
Like the story.
He's so worried.
All right. Let's take a look.
Obviously, I gotta get my gloves on because there is no way on earth that I'm gonna touch her toe without putting my gloves on.
Just take your sockets off, okay?
I'm sure there is pus.
Okay.
It's not red, it's not swollen, it doesn't show any of the normal signs of infection that I thought I'd be looking for.
Any pain pushing at all?
No.
Doesn't hurt to push up?
No.
Well, it looks... Wait a minute.
And the toenail itself has kind of a carved, like appearance where you can just lift the edge in right on the edge of the nail.
Oh.
Doctor, what is it?
The pus is moving. Pus doesn't move.
Oh.
As an ER physician, Dr. Justin Strittmatter has a high-pressure job, and he takes it seriously.
Did you hear about the guy who called 911 and said I'm having a heart attack? He says, how long is the ambulance going to be? Dispatcher says, oh, about 18 feet.
Come on, that's the best material.
Emergency medicine can be incredibly intense. Most staff like to blow off steam on shift. I prefer to keep my focus.
Did you hear about the podiatrist who opened offices next to each other?
A little bit before midnight that night, a female patient came in. Her friends were all clearly intoxicated. They were all in a fairly cheerful mood. What happened tonight?
I was so tired about it.
We need to take you back to your room and take a closer look at
Oh,
it.
good thing. What have you got?
They were all older women in their late 40s, early 50s, and one of them had just got engaged to a younger man, by the way. All right, Kate, just hold still for me here.
1 minute, we were at my engagement party, and the next thing, he's down on the side, really
Was the stupid curve?
Yeah, she was trying to really cab, and she broke her, right her shoe.
Mission.
For posterity, strike a
All right, Kate, you feel any tenderness here? Your face were all palpating. Any that hurt? She had blood free flowing through both her nostrils. She was also kind of spitting up some blood, and she had some blood that was dripping down from her left eye.
Wow, you feel pretty hard in your chest. She might be having
The blood that was coming out of her mouth was actually coming from her nasal sinuses, so once we were able to control the bleeding in her nose, bleeding from her mouth stopped as well. All right, blood pressure's normal. Heart rate's okay. We need to draw some labs on her. Make sure you get a blood alcohol level.
Think she's been drinking?
I'd say so.
setting like that, we're a little more serious, especially when a patient first comes in and we're not aware of exactly the extent of her injuries.
She is ready.
Dr. Cesar Aristeguieta has been an ER doctor for over 10 years.
Morning, Dr. Caesar.
Morning. And he's been working for even longer at his other passion, photography.
You okay? Yeah, just a little sore. Spent the whole day yesterday shooting the hospital fundraiser. My camera and lens weighs about 10 pounds, and every time I go to take a picture, I have to do this. So I'm doing arm curls over and over and over with a 10-pound weight. How many photos are we talking about here? I don't know, like 1,700. I'll get you some ibuprofen. Thanks, Judy. What do we got?
Here's your priority one. Dog bite victim just came in.
Wow, 20-year-old.
Yeah. In the face.
The face? Wow. But it's not just a dog bite, it's a dog bite to the face. And to me that's concerning because your look, your entire persona is about your face. And so this could be something very serious. Did you fill out the dog bite report?
Doing it.
Great, thank you.
Oh, Dr. Caesar?
Yeah,
Did she tell you about the insurance?
what about it?
She doesn't have any.
All right. I know her, I'm Dr. Caesar.
Well, I'm Jack. I'm her father. This dog just attacked her for no reason.
Nora, you in a lot of pain?
I feel so numb and painful.
Okay. Can we get her 4 milligrams of morphine and a gram of cefazolin, please? All right, let's have a look. And at that moment, my worst fears were realized. This is a really serious injury. She has a big open wound to the cheek right here. And it's so large that I can actually see an artery called the zygomatic branch of the facial artery. Wow, and this dog just bit you in the face?
Her friend's dad has a big dog, and she was over at the house, and she goes to pet the dog.
And she reached over to say hello to the little girl. It was at that moment that the dog just bit her in the face. Almost an unprovoked attack. There's a few things that we need to get done before I can even start addressing the injury. We need to start an IV to give her some pain medicine.
Is she going to be scarred for the rest of her life?
The scarring will be a secondary barrier that we'll deal with a little bit later. Judy, can you get a tetanus ready for Nora, please? We see dog bites in the ER all the time, but you see a father-daughter relationship, you see a situation in which there was probably nothing that could have been done to prevent an injury that nobody expected.
I'm sorry, honey, I can't watch this.
It's okay, Dad. I don't want you to watch this.
It's completely unprovoked. That dog's got to be put down.
Your heart goes out to them, to that family, and you feel personally for them because you can see yourself in the same situation.
I don't keep doing it either. I don't know what's going to hurt Emily.
The first thing I notice is that the muscle that helps you purse your lips when you close your mouth has been damaged. It's called the orbicularis oris muscle. So this poor woman can no longer pucker her lips. When she speaks, she's slurring her speech, and it almost sounds like she has a lisp.
How hard is it?
Well, I'll be honest, it's a pretty serious wound.
The dog won't say until you just freaked out or something.
The dog's a damn menace. It's unbelievable.
Then I realize that she has some puncture wounds that I'm not really going to be able to fix. Then I look at her lip, and her lip is cut all the way through on the right side. Can I have that chart, please? So I look at all these injuries, and I'm thinking to myself, I need a plastic surgeon.
Doctor, can I speak to you outside for a second, please?
Sure. All right, it's okay. We're going to take care of this wound for you, and I'll be right back, okay?
Are you going to be able to put her back together?
This one needs a plastic surgeon.
Doctor, I've got no health insurance. I cannot afford a plastic surgeon.
We have plastic surgeons on call. Let me see what I can do. Okay.
Thank you.
Do you know if the dog
deal with this.
Okay, Brian, craziest touchdown ever.
Tennessee Titans, Music City Miracle.
Nice and snag, good fun, running like he's double park. What does a player like that do to the locker room?
Man, it's everything.
Is it? Where's Shaq? Is Shaq available?
Really?
Yeah, because he's not going to say it's everything. Well, if he did say it, he'll go,
New customers bet $5 to get 200 instantly in bonus bets. Plus, over $200 off NFL Sunday Ticket from YouTube TV. The crown is yours. Stingray Stargaze, where starry nights and cosmic vistas shimmer to serene music. Immerse yourself in Stingray Stargaze and experience the wonder.
Say it like you mean it. Victory starts in our feet. Things are not only about to change, but it's going to be better than you've imagined. Do I have any believers and not doubters in the room today? I know we do.
and no greater love has ever been shown to my family.
They got it.
Welcome home. It's all about folks coming together to help one of their own.
This season sounds like, looks like, feels like I do. This summer, I do. On the Duck Trip.
We're in the fight business. All kinds of fighting goes on here. There's no off-season in the UFC. Sickness is real.
Dr. Brent's patient has an unexpected toe problem.
Doctor, what is it?
Oh! There's 5,000 maggots in your toe.
Not many?
Okay, not that many, but they're having a party in there and they brought all their friends.
The tissue where they were living on looked perfect. It did not look infected. It looked pink and healthy and beautiful.
That doesn't sound normal.
It's completely normal. It's gonna be fine. I wouldn't say that I have a phobia with bugs completely.
I'll be right back, okay?
Please be right back.
I just gotta get some supplies. Be right back, okay?
If I see a bug, see a praying mantis, cool, great, awesome. Something that's eating me from the inside out, that's the part that just gives me the heebie-jeebies that, okay, I need to take a second to just deal with this.
Everything okay, doctor?
Hmm? Oh, yeah. Totally fine. Totally fine. We're doing good. Great. Amazing.
The truth of the matter is, it's really not that big of a deal. They really don't cause that much of a problem.
So, maggots are actually pretty good for wounds. Maggots only eat dead tissue. And actually, people use medicinal maggots for a wide variety of wound care applications.
You put a dressing on it, and you have her follow up with the wound clinic, but there's not a whole lot that I really had to do.
You are good to go. You're gonna be fine.
Sent her on her way, and her maggot friends, and off she went.
Listen, you're gonna do just fine.
Okay, thank you so much.
Absolutely. Have a
Have
good
a
day,
good
okay?
day. Okay, bye-bye.
That was an utter delight.
What was?
The maggot farm under her toe. You know I hate things like that. Parasites and worms and all that. And then you give me a patient with...
Well, how are we supposed to know she had maggots? Will you not have extra vision? I know. Nurses are clever.
I would not put anything past the two of you. Okay? Just give me the next turn, okay?
Diaper rash. You should be safe there.
We'll see. Hello. Hi, Dr. Brand. So, what's going on for 100 Day?
I don't think it's diaper rash. You tried everything.
Huh?
got diaper wrapped. I already see exactly what's gonna happen. So I check out the kid, heart, lungs, push on the belly, and kid looks fine.
You gotta take a quick look now, little buddy. It's got so much already. Okay. Oh, right there. Right there.
And I take the diaper off. Oh, boy. I felt like my face was about to melt. This was the grossest thing you could ever imagine.
I'll be back in a couple minutes, Nora, okay?
Dr. Caesar needs a plastic surgeon to fix his patient's severe dog bite injury.
There are no plastic surgeons on call.
Not a one?
No, not a plastic surgeon.
Wait a minute. I know somebody. Went to medical school. This is the best of the best who normally deals with celebrity clients.
Do you think he'll do it?
I don't know if he'll do it, but at least he's credentialed in this hospital. But this is the kind of guy that has a luxurious office and that finds part of town, that drives a nice car, that has a beautiful wife, and a beautiful house, and a beautiful kids. Hey, Arnie? Yeah, it's Cesar Aristeguieta speaking. And so I reach out to him, and sure enough, he says he'll help me out, but that he's tied up in another hospital doing a procedure, and it may be a couple hours. Thanks a lot, man. I owe you one. All right, about 2 hours.
We're gonna wait for him?
As long as it's not much longer than that, we should do it. Here, take this up to the OR, grab me these supplies. I'm gonna go take some pictures of her once and email them too. So I send nurses to the operating room to get a special suture trays and special sutures and what I need to fix this in case something happens and he doesn't show up.
This is not going on my profile online.
No, these are for Dr. Keys. They'll help him to plan for the procedure that he's gonna do to get you all fixed up. You know, Nora, I have a daughter that's your same age.
Really?
Yeah, so I definitely understand how your dad would feel. I'd be pretty upset too.
At least you'll be able to stand outside of blood.
Yeah, I tell you, I'm not sure. I think it's different when it's your own family.
Dr. Caesar, I've got a call for you. It's Dr. Keys.
I'll be right back. Hey, Ernie. Yeah, I just emailed you those pictures. He tells me, hey, Caesar, I'm going to be in the operating room for at least another 2 hours. When will you know? We've already been waiting a couple of hours, so this is now adding up to 5 or 6 hours after the injury happened, and I'm starting to worry. All right, keep us posted. Thanks, Ernie.
Doc, I can't get a hold of anybody. These jerks don't even have voicemail. But who doesn't have voicemail? It's unbelievable.
It's okay, we got time. Yeah, there's a girl in her face is bitten by a dog.
Oh my God. That's him. What the hell are you doing here?
I just want to see how she's doing.
How she's doing? I'm so sorry. Where's the dog?
He's tied up. He's in the yard tied up.
I'm calling animal control, and that animal's gonna be put down.
And I understand how you feel.
No, you don't. Your daughter's still in one piece.
It was an accident.
What?
Before anyone can stop him, the father just punches this guy in the nose. You okay? And now I got another patient to deal with.
Her initial assessment didn't show injuries anywhere else other than what was obvious. She'll be discharged shortly. And just as I was literally about to walk out of the room, he took a last gasp of breath.
Something is wrong.
CAT scan results up yet?
They should be up in a minute.
Dr. Stricklander's intoxicated patient did a face plant on the sidewalk. She's feeling no pain, but is she hurt?
So what's my prognosis, doctor?
I'm reviewing your CAT scan shortly. How you feeling?
Oh, I told you I feel fine. Oh, that's stay in.
All right, well, I'll be back in 2 minutes to check on you. So her initial assessment didn't show injuries anywhere else other than what was obvious. I reviewed her scans with her radiologist.
I don't see any intracranial hemorrhage.
She did not have a head injury. She did not have any fracture or dislocation of her cervical spine.
There's an orbital wall fracture here, the left eye.
Looks like she's got a nasal fracture of the deviatus and right as well.
Labs for your patient. Interesting reading.
Blood alcohol level was over 4 times
should we go?
She'll get discharged shortly.
Did you find my shoes? I don't like your shoes.
I'm sorry we haven't seen her. Just as I was literally about to walk out of the room,
I think I'm having a heart attack.
she sat up in the bed and clenched her chest. Probably just feeling the bruising in your sternum from the fall.
I'm having a heart attack. It feels like a heart attack.
Wasn't convinced she was having a heart attack, but I'm going to cardiac monitor just to be sure.
Riley, you're doing something. You guys know.
Listen, she would say, yes, I am. I would tell her, I really don't think you are. And she would say, I really think I am. Okay, your ST segments for monitor are normal. I really don't think you're having a heart attack.
It feels like a heart attack.
Just take a deep breath. She took a last gasp breath.
Something is wrong.
Oh, really glad it wasn't there to stop me. But I'm really gonna see hers now. Alright, now that I've recovered a bit, let's chat about nursing and nursing options. If you're looking to advance your nursing career, Nursing University offers over 5 MSN nurse practitioners programs. There's even traditional and accelerated pathways available to choose from. And if you're new to nursing, Nursing University also offers an MSN direct entry program, which is designed for students who hold a bachelor's degree in a different field of study. Okay, Brian, Craigslist touchdown number.
Tennessee Titans. Music City Miracle.
I just snagged this son running like we double park. What's the play I gotta do to the locker room?
Man, it's everything.
Is it? Where's Shaq? Is Shaq available?
Really?
Yeah, because he's not gonna say it's everything. Well, if he did say it, he'll go.
New customers bet $5 to get 200 instantly in bonus bets, plus over $200 off NFL Sunday Ticket from YouTube TV. The crown is yours.
This is it. One of those moments you'll never forget. Celebrating a true milestone with the people you cherish. Everything is perfect, but it almost wasn't. That's where we come in. We're Lee Company. We'll be there when you need us most. To make sure all your life's moments are ones to remember. We want you to focus on living your best days in your home. Don't worry. We'll take care of the rest. It kicks. It's spicy. It punches. And it takes no L.A. Watch Del Rey Rep on the Roku channel.
What is it?
Dr. Brent has just had his second surprise diagnosis of the night. This was the closest thing you could ever imagine.
Oh, buddy. I know what this is. At that time, then I see about 2 million small pinworms creeping out all around this kid's ears.
Millions? Is that impossible?
I'm exaggerating, okay? He's gonna be fine. But, here, let me show you what we're dealing with here, okay? Alright, just take this regular tape, okay? So we'll just put a little piece of tape on there, okay? And this right here is what we're dealing with, okay? Yeah, so it's a wow factor, but you know what? He's gonna be just fine. I didn't say another word. I took off my gloves, threw them in the trash, opened the curtain, and just got out of there.
You okay?
Huh? Oh, yeah, great. Try this water? Great water.
You look sweaty.
Do I? It's just the glow of good doctoring. That and looking into 20 million pinworms in room 2.
Oh no!
Nightmare fuel.
Dr. Brad, I am so sorry. I had no idea.
Sure, whatever. You stick to that story. So, these are pinworms.
I don't get it. We've never seen anything that looks like worms.
Pinworms, a lot of times, you won't see them during night when they come out.
It's very simple to treat it. Get a medication. Okay, I have a medication for you guys.
It's contagious?
Well, anytime we treat inwards, we treat him, but we also just treat the whole family, okay? And he's going to be just fine, okay? I'm gonna leave the prescription here for you guys, all right?
Thank you.
But who you doing? Okay.
They're out of the ER, they're going home. I can still vividly see this, probably till the day I die in my brain, but what are you gonna do about that?
Oh, okay.
Bay number 5. Back from the tropics with diarrhea.
Tropics and diarrhea? Okay. No, thanks. I'll take my own. Thank you very much. How about Bay 1?
Suit yourself.
A little girl with something stuck in her nose. This happens all the time. This is a very common complaint in the emergency department.
Oh, hi. Hi, Dr. Brandt. Hey, Summer? This one, Summer? Boom. I understand Summer's got something going on with her nose.
Yeah, it's driving her crazy.
Okay.
She was camping in the backyard tonight.
So she slept in her tent, and then she came back in a little while later and complaining about her nose.
Okay, so the nose is driving you crazy. Which side is it? That one? Just itchy in there? Okay. So before she went into the tent, doing fine, no problems. Okay.
Any past medical problems, any surgeries? No, everything's fine. Kid's healthy, happy, everything's good, except there's something up the nose.
Alright. I'm gonna take a quick peek. This is my flashlight. Okay? So I'm just gonna take a look inside your nose. Chin up, chin up. There we go. I'm gonna take a quick peek inside, okay?
Go in, take my little otoscope, and I look in the good nostril, look nice, good. Look in the bad nostril, or there's something in. It's way in the back.
Oh my gosh.
It's not that common that you're going to see an insect complaint. To have one in a night, it's okay, fine, gross, but I can deal with it. 2, kind of uncommon. 3, no. This is like somebody's playing a prank on me.
You have got to be kidding me.
Doctor, can you take a phone call?
Sure.
Now he's saying, listen, Caesar, I don't think I can get there in time.
Okay, thanks.
It was an accident. What?
In Dr. Caesar's ER waiting room, the father of a dog bite victim has just encountered the dog's owner.
Yeah, I think my nose is broke. Don't worry, we'll take care of it.
Do you want me to call the police?
Oh, please don't. No, I'm not gonna breastfeed this. Let's get this thing x-rayed, throw an oxycodone, and let's peck his nose, okay?
Thank goodness I have some help on this patient because things are happening in the ER so fast. Everything's starting to get backed up, and I haven't even started working on this, fixing this face at this point.
Nora, everything's under control. You don't need to worry about anything.
Am I gonna arrest him?
Nora, the man that your dad punched, he said he doesn't want him arrested, so he should be fine. There was something else. The surgeon is tied up in the operating room, so we're gonna have to get started without him.
You're gonna do it?
Yes, Nora, but don't worry. In my training as an emergency physician, I've taken care of a lot of wounds. I use the same procedures that the plastic surgeon would use, so we're gonna be fine.
I don't do something this serious on a daily basis like a plastic surgeon would, but in many cases, we end up being the ones having to provide the best care available because there's nobody else.
Okay.
The problem is, I can't leave a face wound open. It's so disfiguring, and it's causing her problems to speak, and there's arteries exposed. There's all kinds of problems associated with leaving this wound open.
You're gonna feel a little pinch and then a little bit of burning from the medicine, okay? But then everything will be numb, alright? You're doing great. Alright, we're gonna get started here. We're gonna take some sutures and start bringing everything close together for you, okay?
Imagine trying to put a jigsaw puzzle together. You start pulling pieces, and you kind of look at the pieces and the colors, and try to figure out if this matches here or this matches there. But remember, this is a very deep cut, both in the cheek and in the lip. And so I have to start from the inside out and hoping that as I fix the inside, the outside starts coming closer together.
Are you okay, Dr. Caesar?
Yeah, I'm okay. How are you doing?
Are you okay?
I had been photographing all day before, and I'm kind of sore. And my arms are very sore, my back is very sore, my neck is sore. Now I need to start going into that mental place where you block pain in order to keep doing the task and move forward.
Alright, Nora. Looks like everything's coming together nicely.
And now I see the jigsaw puzzle starting to line up.
Alright, your cheek is looking good. Now we can get Dr. Keys to work on your lip.
Doctor, can you take a phone call?
Sure. And it's my plastic surgeon friend again.
Hello?
Something has happened, they got the freeway shut down.
Okay, thanks.
He's not that far away, but the traffic is stopped. Now he's saying, listen, Caesar, I think you're gonna have to do the lift too. My back is hurting, my arms are hurting, everything is sore.
How long?
Oh, too long.
Minutes before being discharged, Dr. Strickmatter's patient has lost consciousness.
See a crash car in room 3?
See the nurse's station, can usually be 2 or 3 nurses, tech sitting there. I looked up and I saw no one sitting there. So I knew I was, at least initially, I was, operating alone. Using a rhythm called ventricular fibrillation or VFib.
Guys, listen, you need to help me. You're gonna need to move her. You can unlock the bed there. Unlock the bed. It's right by your feet.
Typically wouldn't move a patient that goes into VFib from one room to another, but I knew that room was open. I knew that's where all the equipment that we needed was.
Take off her blood pressure cuff. Right there. Take off her blood pressure cuff. Take that pulse ox off her finger. Just rip that off her arm. Just rip that off her arm.
When I disconnected her off the mic, I basically just grabbed all her leads and ripped them out of the wall.
Got it? All right, let's go. Let's go. Stay back here.
What do we do now?
I went from one-handed CPR to two-handed CPR.
You need to hit the code button. It's that red button there on the wall.
I don't have my reading glasses on.
The red button behind you. Can't miss it. Right there.
She went over and hit that button, which sounds an alarm in the car then.
Nobody's coming. Nobody's
They
coming.
will. They're coming. They'll come. You two should go out there and find me a nurse. Okay, thanks.
How long?
Too long.
With the plastic surgeon stuck in a traffic jam, Dr. Caesar has no choice but to repair the mangled lip of his dogfight victim on his own.
So I'm gonna approach the lip, which is the more significant injury now.
You know, just book with Dr. Keys, and he's caught up in a freeway closure right now. We don't know how long it's going to take for him to get here.
Oh no.
Don't worry, I'm going to take good care of you. We'll have you put back together in no time, okay?
I can see that the muscle that helps you pucker your lips, it's been cut through. So the first thing I have to repair is that muscle that's been torn. And I have to put some stitches across that muscle, which is always challenging because muscles were not made to take stitches.
If I don't get this part right, there could be an obvious divot on the lip, and it could be disfiguring. And she could even have a lisp in her speech, which would be for life.
Are you sure you're okay, Dr. Caesar?
Oh, I'm okay, Nora.
We're all very good at blocking pain, blocking sleep, blocking thirst.
it from different angles and shine the light from different angles and make sure that it indeed was lined up correctly.
Yeah, that's the one. That looks really good. You look really good, Nora.
Can I have a mirror? Can I see? Are you okay?
Am I okay? You kidding? I'm so sorry, Nora.
Dr. Brand is about to get the hat trick of emergency cases.
Oh my gosh. You've got to be kidding me.
What is it?
There's a bug in there.
What?
A bug? Yeah. Of course it's a bug. Of course it's a bug. What would it be bug?
I don't mind bugs at all. It's just, as soon as something is eating you, something is inside of you, that's the part that makes things twist a little bit inside of me. I can put on a brave face while I'm in the room. I can buy myself enough time like, oh no, that's just a normal thing that happens with medicine. And then smile and nod until I let myself out of the room that much time.
That's no big deal, right? I mean, you just have to get it out.
It's lodged real deep in there, okay? So, I mean, a lot of times you can try to get it with tweezers, so there's some other stuff there. It really is pretty miserable. So, there's a trick that we do, and we do this all the time in the ER, okay?
The trick is something that I learned in residency. You have the mom cover the good nostril and blow forcefully into the mouth, and literally you can have them force air out of their nose, and if you're lucky, whatever's in there will shoot out.
Did you hear all that? Does it make sense? You ready to get that thing out of there? All right, so chin up a little bit. I'll cover up. All right, you ready? 3, 2, 1.
Out from the nose comes a projectile at about 1,000 miles an hour, a giant black earwig. Where is it?
I don't know. It just ran away.
Dad stands on the chair.
Sweetie, who are you?
You okay?
Daddy's gonna be fine too.
That thing out of there? Good. You did great, sweetheart.
So that was the last insect that I saw that evening.
A toad full of maggots, a butt full of pinworms, and an earwig the size of a small horse.
I've never been afraid of that, man.
Oh, it is so not funny.
Yeah, it is. But we had nothing to do with it.
Every ER doctor has their thing. Blood, guts, horrible odors, no problem. Oh, yeah, right. I just happened to get all of the bug cases all in one day.
Yeah, total coincidence. Although, I'm kind of wishing we had now.
Oh.
When you said earwig, did you mean that earwig? Oh,
I'm not falling for that.
no, seriously, right there, it's coming. Oh my gosh, there he is. Look at it. Oh, hi there, little guy.
When it comes to bugs, I'm really only freaked out when they're on the inside. Get them outside the body. I'm a superhero. Oh, come here, little guy. There we go. Kind of funny. That's what I thought.
Oh, out of here.
Straight field goals on the 1-yard line at this forced by Franklin. On 2nd and 10, next to the end zone. Touchdown! It's Trotman. Where the free safety is. Right now, Nex knows the free safety is leaning to his left. He keeps him there. Luke Rhodes is the snapper seat.
Is this your attempt to be sympathetic or are you twisting the knife?
Escape.
Get the hell out of my house.
Support Charles anytime.
I won't have to lift a finger.
24 hours a day. From the General Hospital Channel. When it comes to big personalities, Dr. Phil's Mera TV has the biggest Grace.
You have to be under a rock in a cave on the other side of the world not to know about that.
And the man himself, Dr. Phil.
You hear this fella, prescription.
It's the best of Dr. Phil's Mirror TV on Roku.
True crime all the time. ABC's 2020 is now streaming 24/7.
True murder history.
Sex, betrayal, lies.
Bombshell. The greatest true crime stories.
Now streaming on the 2020 channel.
Dr. Strip Matter finds himself alone just when he needs help the most.
You two need to go out there and find me a nurse.
Waiter!
I'm gonna take over CPR for me.
She going to die.
Hey guys, I need you both to wait outside, okay? Wait outside. She's gonna lead fib. Let's charge up at 360. Alright, I'm clear, you're clear. One's clear, shot.
Shocking?
Shocked her with 360 joules. She didn't respond. Alright, she's still in lead fib. Check her again at 360. She was shocked the second time. Clear?
Shocking?
Did not respond to that. Good waiting, shocked her a third time. It's gonna charge back up. Shocked her a third time.
Shocking?
She didn't respond. Alright, she's in shock refractory VFib at this point. We're going to give her a 1 milligram of epinephrine IV.
The IV's infiltrated.
An infiltrated IV is one where either the vessel wall has exploded or the catheter has come out of place and is no longer inside the vein. That means we have no immediate way of getting the drugs into her circulation. Alright, I'll do an EJ.
Switch.
I'll take over here. It's your only choice. We need access. Having a 14 gauge. Let's prep the right side of the neck. I place an external jugular line. It's not a site that typically place IVs. It's usually an access of last resort. Now let's charge back up 360. Shock her again. Alright, clear. Shock her.
Shocking?
She's in the narrow complex. Rhythm, pulse came back, blood pressure came back. She was breathing for herself. Not adequately, but she was breathing for herself. Keep back at her.
Can we give an EKG in the trauma bay, please? Staff?
So once I saw that, I called the cardiologist. EKG shows an ST elevation, MI, inferior wall. She needs to be anticoagulated with heparin. She's post-trauma. I just don't know if we can wait. The medicine we typically give a heart attack patient is a blood thinner. My concerns were that she might have uncontrolled bleeding, in her sinuses, her mouth, and behind her eye. Okay. All right, thanks. Cardiologist can't get in for another 30 minutes. So it was one of those decisions where the risk-benefit was difficult to discern if one was greater than the other. But we can't wait any longer. We need to start the heparin now. Not to take the risk of bleeding complication.
Dr. Caesar? Dr. Hughes has just arrived.
He wants to come in and see what I did. And frankly, I'm expecting that he's not going to be very approving of what I've done.
Dr. Caesar's dog bite victim has an unexpected visitor. The dog's owner, who was assaulted by the girl's father.
Oh man, broke your nose. Look, I'm really sorry.
Yeah, listen, right up there.
I'm sorry, I just lost it. I'm really sorry.
Forget it. Forget it. I'm
No hard
sorry.
feelings. Thanks.
We'll keep in touch.
Okay. Oh, you look so much better.
We all look bad.
I know. Honey, you look beautiful.
Dr. Caesar? Dr. Keys has just arrived.
Okay.
Barney. Caesar. Hey, how are you doing? Great. So sorry, man. We were just out of control.
No problem, I heard. Thanks for coming. Good to see you.
How's your patient?
She's doing good. I finished up the lip about 3 minutes ago.
Wow. Can I take a look?
Sure. He wants to come in and see what I did. And
Dr. Keyes, my nurse Judy, this is Nora, and her dad Jack.
Hi.
Nice to meet you. Hi, Nora.
Hi.
Let's take a look.
You feel very well, Nora.
Thank you.
Outstanding.
Oh, thanks. To my surprise, he's very praising of the work that I've done. Judy, we'll get you all bandaged up and we'll get you home, all right? See you guys.
Thank you, Doctor.
Oh, my pleasure. My pleasure.
Thank you.
Take care, sweet.
Caesar, you're not hearing me. I saw this patient's injuries before. From the pictures you sent me, I can't believe how good you made it look.
Oh, wow, Artie. That means a lot to me.
Well,
Thank you.
I gotta go.
All right.
Good seeing you again.
Yeah, likewise. I appreciate you coming by.
Okay.
Doc. Yes, sir.
Get you to take a picture.
Sure. Now, where are you?
We want you in it.
Oh,
In it with us.
Oh, okay. Thank you.
The prediction of Dr. Caesar's plastic surgeon colleague would prove to be true. Within months, the patient's wounds healed completely, leaving only minor scars.
She could certainly see herself in a new light, and she said that I had changed her life.
Dr. Justin Strickmatter has made a risky decision for his patient. Was it the right one?
The cardiologist came straight into the hospital. He was there in approximately 30 minutes.
All right. How's she looking?
So far, so good. She's spontaneously ventilating. No further arrhythmias, none so far. But I made the right choice with the heparin. Heard she went into defib right in front of you. She did. It was bizarre. Let's get her down to the cath lab and see what we find. She'll need close monitoring for any bleeding. Well, it's proper to go to cath lab. Took the patient to the catheterization lab, found a blocked vessel in her heart, which had caused her a heart attack. He opened up that vessel and placed a cardiac stent. She was taken off the ventilator the very next day, and she had an uncomplicated postoperative course. Okay, we're gonna take an X-ray, make sure it's not fractured. Amazing recovery. She left the hospital a week later without any deficits, except for facial injuries. Needed a plastic surgeon. Like I said, home? All right.
Thank you so much for everything, Doctor.
You're welcome. We found something here I want to give you.
Oh, a shoe.
This is a souvenir of your stay here at our hospital.
Oh.
You're good. It's very rare that a patient would tell you that she's actually having a heart attack and then actually go into dysrhythmia while you're standing at the bedside. If we would have released her 30 minutes sooner, she would have gone home, probably not survived the ambulance ride back to our ER. They were arch enemies. Podiatrist opened up offices next to each other. They were arch enemies.
Just crack a joke. I think he did. Oh. He just cracked a joke.
These are the stories of the ER doctors never talk about.
There's no training that prepares you to be in the middle of a gang fight. If he dies, we'll all die.
Suddenly, everything changes. I could tell there was not enough parts in the glove to make up my fingers.
I've been preparing for him.
I won't let you die. He's gonna die, and it's gonna happen fairly soon.
I hear this commotion outside the room.
These are the ones I'll never
fairly quick replant we're trying to get of this index finger.
I'm in the OR, and I'm scrubbed in with the resident. We're doing a replantation on the young female. And I get this call.
OR. Yes. Who? He's here. Hold on. Rick, they need you in the ER. Dr. Sparks called. He has a four-finger replant. They need you down there right away.
And I'm thinking, why is he calling me?
I'm sorry, does he not know that I'm doing a replant?
Doesn't he know that you call me ahead of time before he's giving me a patient with four fingers cut off? That would make me angry. I would like, come on, Steve, give me a call.
Well, take care of yourself.
Dr. Sparks is the patient. He's the one that cut his fingers off. He's driving here as fast as he can.
Dr. Stephen Sparks is not only the hospital's senior surgeon, he is also Rick Bordeaux's friend and mentor.
Suddenly, my heart drops. Everything changes.
While building a fence in his backyard, Dr. Sparks, the chief of vascular surgery, accidentally caught the glove of his left hand in the spinning blade of a table saw.
You, Howard Lee. Hey, Dr. Sparks, he's mangled his hand. He's in the ER.
Is Rick here?
He's in the middle of surgery, but he's able to be right down.
Anyone else who's not operating?
Although Dr. Sparks is right-handed, a surgeon's secondary hand, known as the assisting, is considered 80% as important as the primary hand. Even the most subtle loss of coordination can mean the end to a surgeon's career.
We'll take care of him.
Strategy 3 for trauma, rescue 3 for trauma.
So, rescue 3?
Trauma, I got a code 3. Inbound with a 20-year-old male involved in a street fight, unknown entry. BP 120 over 8.
Copy that.
From about 3 a.m. to about 7 a.m. in the morning, you're completely alone. You're the only doctor basically in the whole hospital. All right, hey, what do you guys got? James L. 82, possible status. Hey,
Trauma 4.
20-year-old Joseph Wynn was wounded in a gang fight.
What's your name? I can't hear. Hey, Joseph, Dr. Carroll. What happened? We got some blood here on your shirt. Let's go and get it moved over to the gurney. Go and get him on the monitor. Get a couple IVs going on. Joseph, can you tell me what happened? Looks like he's got a stab on the right side of his chest, upper abdomen, lower chest.
no sooner does this happen, then boom, all of a sudden, across the room, I can tell I've got a much more serious situation on my hands.
Silicone security.
19-year-old Trey Tran from a rival gang has become the second major stabbing victim.
1, and 2, and 3, and lift, and over.
So now things are getting a little warmed up. Now I've got 2 stabbing victims, and it appears what I've got on my hands here is a gang-related incident.
Can you go lock that door? It's all for security.
Meanwhile, there's a monitor that's actually in the main part of the emergency department. This monitor is hooked up to a camera, and on the monitor there appears to be a collection of some 19, 20-year-old youths that don't look too unlike the 2 patients I'm taking care of. And it seems that there's some conflict developing.
What's going on outside? Can I get an ETA on surgery, please?
I'm the night shift solo doctor, single coverage for the next 4 hours, and this situation quickly escalates and ratchets up and becomes almost a little more than I can handle.
It's Mr. Caramo, but you already knew that. Both of you are deciding to be damning and not here. If you want real people, real drama, and real love, there's a lot of love in this map, so don't destroy it. What's confessed by Nosy?
Stream full episodes of The Garofalo Show. And We're Not Gonna Play Today, and much, much more. Trust me, I know those. You are not. Watch the best I know. Streaming now on the Roku channel. It gets real with On Patrol Live on Patrol. That's what it says.
It sounds like Mom's really worried about you.
It was a dark day, but look at the amount of light that came from that dark day.
On Patrol Live Encore, streaming all day and night, every Saturday and Sunday on Reel's Famous Ninjas.
Imagine better way to set the stage for the program.
Whoa. What are we waiting for?
Two.
You.
Can I get a win?
Things are a little different.
We have 1 hour to leave the house.
Don't blame me.
You already know how I feel about my family.
Y'all know what time it is?
Well,
He began spying on women. They became objects that existed only for his pleasure.
As the head of an ER, Dr. Keith Bradley is used to calling all the shots. But occasionally, even an ER doctor has to yield to a higher power.
mate, there are some times in an emergency physician's career when things just seem to be going along absolutely terrifically.
Yes. I mean, she's really special. Oh, what's so special? How special? You'll see.
Sister, the doctor's here.
Sister De La Rosa has been a nun for more than 70 years, and her reputation precedes her. Back at the convent, she's both loved and feared.
Sister De La Rosa? The patient that I see there is a Roman Catholic nun, and she's clearly having trouble breathing.
Dr. Brett.
What? Honey, you're the line of business.
When this happens, I'm sitting right back again, and I'm in a flashback. I'm 6 years old again, and I'm in the first grade.
Sister, it says here that you have chronic emphysema and that you have trouble breathing.
Sit away. I told them, don't bring me here.
If you could just please breathe for me, sister.
So I quickly listen to her chest, and what I hear are really, really tight wheezes.
Honey, that's enough. Now leave me alone.
I've seen a lot of these kind of patients, and if they don't have the breathing tube, if we don't intubate her, I am absolutely convinced she is going to die, and it's going to happen fairly soon.
I won't let you die. My patients don't do that.
The thing you said, lying. Well, none. Just leave me.
Now, all we have to do is put a tube inside your throat, and then from there, you'll be able to breathe a little better.
Better make me better. You swear.
Yes.
That's 2 lies. I know a piece will be very easy with you, with a parent. That will be 500 Hail Marys.
Excuse me?
I think I made everything very clear to you. Now leave me alone and let me die. I told them, don't bring me here.
Dr. Keith Bradley, a former Catholic school student and altar boy, is desperately trying to treat an elderly nun afflicted with emphysema. But his stubborn patient refuses to accept a breathing tube and says she's ready to meet her maker.
It's clear that she's in real respiratory difficulty. She looks like she's somebody that's getting ready to die.
I got a little machine here. It's just going to keep track of how you're breathing, okay? So it doesn't hurt.
want to die than have that tube down my throat. And you didn't want before you, huh?
I knew there was a problem that time. This time there won't be a problem, I promise.
The sister looks at me and she then says again, no tube.
With a turf war erupting outside his emergency room and 2 critical stabbing victims on his hands, Dr. Gregory Carroll needs help, and he needs it now.
What else, security? I've shifted into management mode, and, we're security. Can somebody get security right now? And I hear this voice go right here. There's a guy that doesn't weigh more than $1.20 saying, I'll go take care of the situation. I just kind of rub my brow and like, all right. Police file surgery also. Like to get him down here with some help. Considering my situation with security in the waiting room and my surgeon, my backup at this point isn't looking too good. How you doing? Okay.
With no backup, Dr. Gregory Carroll must save 2 dying patients from rival gangs. All the while, their comrades are facing off in the hallway.
Full loss of 85%. He's driving like a stone.
We gotta get this in. We gotta get it to this kid's chest. Realize this guy's got air in his chest or a lot of blood in his chest. We're gonna need to relieve this immediately. Can I have $400?
Dr. Carroll decides a second tube to be inserted in Trey's chest is his only hope for survival.
Am I going down about sliding cane? Scalpel? Okay, you're gonna feel a little pop and some pain here. Yes, sir, please. Spreading. Big breath. Okay, my friend, keep breathing. Okay. Chest tube's in. Let's have someone secure. Let's do some tape and secure this. Put the chest tube in. Get this rush of air. Very dramatic kind of rush of air. Okay. Keep breathing, okay? And even deep breaths. At this point, I'm feeling on top of the world. How's the guy doing over there? Second patient appears to be stabilizing. I'm getting the situation under control. We've got security somewhat getting things under control. On the video monitor, a full-blown melee fight ensues, and the security guard who's gone out to help is on the bottom of this pile out there, completely out of view. At this point, I'm getting a little uncomfortable. We've got to fight out of the waiting room. In my experience, gangs have been known to come back to the emergency department and finish the job off. Sorry, man. What's going on? No. All right. Call the coach. Put the police on. Put everything on lockdown. Let's get the cops in. Let's get the police in here now.
This is the ER. We need to call in code gray. Call in code gray. We need to lock down the hospital. We need to cops here right now.
Is there anyone else without the green?
In the ER, all patients are supposed to be treated with equal urgency. But when the patient is the hospital's chief of surgery, who mangled his own hand in a table saw, the response is much more personal.
What room is Steven?
Down 2.
Call Dr. Vignette. I need him like yesterday.
Got it.
Oh, Steve, I'm so sorry.
I could tell there was not enough parts in the glove to make up my fingers. Several of them were not physically missing, but were crushed enough to when I squeezed my hand together, they all squeezed together into a very small bundle, meaning that they were all mutilated.
This
has huge implications for his future. He knows it and I know it. And this just has to go as good as it can be done.
It's okay, Suzanne. It's okay.
We're going to do good here, okay? We can put it back on here.
Steve's wife, Suzanne, arrives having just gotten word of the accident.
I wasn't really angry or anything like that. It just hurt really bad.
It's just funny, man. We'll just figure it out. Let's go see what
medial surface. This one right here is sort of, I can't feel it in the glove. This one here, I think, probably has some fractures. And as he starts listing to me the injuries he thinks he's got, whatever you got on any replace my fingers. So all we can do in this example is in general, 85% of people who have this kind of hand injury never return to normal function.
Dr. Rick Bodor is assessing the damage done by a table saw to the left hand of his friend and mentor, Dr. Stephen Sparks. As the hospital's chief of surgery, Dr. Sparks' entire career is now in the hands of one of the department's most skilled surgeons.
We're going to save every part of this glove, okay? Inside it, any tissue left in it, we got to save. Not sure about the it's okay. Can I get a new set, please? I got for you there. All right, we're going to take it, here it is, okay? We're going to retrieve it back, okay? Get it back. They have a left hand injury to where you know you're going to be missing fingers from it. I was thinking that my career as far as vascular surgery was definitely over, which is really sort of a tough thing for a chief of surgery to go through all of this in his own hospital. So the stress, internal stress level on me is immense. Let me tell you, it is a severe case of
Good. Just relax, okay? I know it's bad, but I know you're going to do an amazing job.
He turned to me and just stopped me right there and said, "Hey Rick, I've got great confidence in you. I know it's doable. It'll be done." And that really made me feel much more comfortable. Maybe uncomfortable for a second, but I hit it and let me know I go a little slow and you give me feedback, okay? Yeah. All right? This is about 20 seconds. Is that all right? Yeah. All right, good. Move the gauze, please, on the underside. Excellent. Okay, we look careful here. Keep every finger remnant. Okay, anything that's in the glove, be safe. You might be able to put it in. Yeah, you're right about that index. That is just devastating. It's okay. Good. Okay, feeling on it. He looks at the nurse and goes, "Give him 8 milligrams of morphine and then 1 milligram of morphine every 2 minutes until he stops speaking."
ER Dr. Chris Mikos has learned how to combine his work with a little bit of pleasure.
Come to me, baby. Come to me, baby. You're going. Go.
Fortunately, I work with people that realize there's many facets to medicine. This is Dr. Mikos, our resident bookie.
Sorry.
And humor is one of the ways we get through our very stressful periods. I hear from the nurse that we have a patient who seems to have injured their hand.
A patient with hand through a window, bleeding pretty badly, wrapped in a t-shirt.
But humor isn't going to help Dr. Mikos with his next patient. Todd Ryan has come to the ER bleeding severely from his left hand.
Hand through a window, bleeding pretty badly.
Mercy. You always have to be concerned with the severing artery. The heart pumps so strongly, and you only have a small amount of blood in your bloodstream. If you don't take care of that very quickly, you could bleed to death.
Hello, how are you?
With gang violence erupting in his ER, Dr. Gregory Carroll has no choice but to call for a complete lockdown of the hospital.
Let's get the costumes facilities here now. We now need to create a little protective world that no one can get in and no one can get out of. And that's code gray. All the doors locked down for the entire hospital. All security are dispatched to the perimeter of the hospital, guarding all entrances. Most importantly to me, the emergency department. Hey, can someone call trauma surgery? As soon as I call code gray, we start lockdown. The phone rings again. It turns out there's actually a third victim.
The hospital is now only 2 minutes away from total lockdown as the third victim arrives.
One paramedic is doing CPR as they're pushing the gurney.
With two gangs still roaming the hospital, paramedics elect to use a service entrance.
1 minute later, paramedics come bursting through the door again.
The newest victim, another young Vietnamese male named Mike Trong, has sustained 2 serious stab wounds. One of the wounds is near his heart, and if not for the paramedic performing CPR, he'd be dead by now.
I think we're just going around.
When patient 3 rolls in, it's no longer a normal emergency department. In my mind, we've called the code gray. We're on internal disaster at this time. So the rules change. Now at this point, I'm in survival mode.
All right, you tell me to give you CPR. You got ID access card? Yeah, good. Let's go ahead and come to the line, see what we got.
Please stand.
Dad? Someone call surgery again. Sir?
Dr. Carroll suddenly finds that despite the lockdown, his ER has not been completely sealed off.
That's my boy. He's pretty sick. You want me to take care of him?
My boy better walk out of this. He dies. You all die.
The ER has become ground zero for a gang war. Dr. Gregory Carroll and his team find themselves caught in the middle. Mike Trong is the gang leader of the Vietnamese Crips, and his top lieutenants are here to make sure he survives.
Sir? Excuse me.
The only way these guys knew how to express how much concern they had for their friend and to ensure that he got taken care of was a threat in my life.
If you wanted to live, you need to back off. Let me do my work.
And I just stopped. I looked him in the eye and I go, hey man, ain't nothing's gonna be able to happen if you guys are vibing me like this. And I said it just like that. I kind of tried to speak to them in somewhat in the language they were using, but being non-confrontational.
In a last-ditch effort to save Trong,
Scalpel?
Dr. Carroll performs a thoracotomy,
Making a decision out of his left chest wall?
cracking open the patient's chest so that he can administer internal CPR or cardiac massage.
Incision?
The thoracotomy involves taking a scalpel and you make an incision in the left part of the sternum here, all the way around the side here, almost all the way around to the back. So you're basically making an incision on this whole left side of his chest wall.
Chest wall's open?
Open this guy's chest up,
Put my hand in?
reach into his chest, and this is probably one of the more dramatic things in emergency medicine.
Got the heart?
His heart. His heart is still moving. It's flexing. The muscles are flexing, but it ain't moving any blood.
Cardiac massage?
So I start, instead of external CPR, I start internal cardiac massage.
Holding? Got no electrical activity. Continuing CPR. Continue bagging. Does anyone see trauma surgery? Let's give them another call.
When the surgeon finally shows up, he looks at the situation and says, what the hell's going on?
What's going on here?
And I said, welcome to the ER.
Dr. Mikos, the emergency room jokester, has a patient with a serious problem, a severely cut hand.
Shake your hand. I don't think it's really good.
He tries to relieve the tension with his characteristic humor.
Shake your finger.
Okay. His hand is completely wrapped in gauze, and there's a fair amount of blood on the bandage, which alerted me that he's got a serious injury.
I'm going to take this off. Might hurt a little bit. Ready? Feel it over here. Feel it. 3, feel it. 4, feel it. Feel it.
He had cut it in numerous places. And I asked him,
What have you been up to? I'm gonna go over. Pissed me off. Like, she would be mad, so I guess I went over or whatever. Where did you do that? Just did it in front of her. I'm not here to judge you. Just relax, okay? Try to keep still as you can, okay? All right. Hold it level. Like I said, I punched a wall. A wall? A wall or a window? Right. Kitchen window. Kitchen window.
Something about Todd Ryan's window story doesn't ring true.
Just didn't seem to be as forthcoming as I kind of expected him to be. And I'm getting all set up to get ready and
Just relax. Almost not the first time.
about halfway through what I was doing, my colleague comes in.
Hey, check this out. Come here.
My colleague sort of took like a little bit of a long stare on the floor. And I wasn't sure what that was all about, but it even caught me. And he didn't say much to me. He just walked out.
What?
That's fine. I mean, I didn't expect him to be more sociable, but he just walked out fast.
I thought it was going to be fine.
Something suspicious is going on, but Dr. Michaels has no idea what.
This is it. One of those moments you'll never forget. Celebrating a true milestone with the people you cherish. Everything is perfect, but it almost wasn't. That's where we come in. We're Lee Company. We'll be there when you need us most. To make sure all your life's moments are ones to remember. We want you to focus on living your best days in your home. Don't worry. We'll take care of the rest.
Going to ride with us? There you go.
Did your guns, boys. That's the way of the West.
If you want real people and real drama, you do not tell the truth. Watch Nosy. Stream full episodes of the Steve Wilkos Show. Get off my stage! And check out classic episodes with Jerry Springer and Mike.
All the time with Perry Davis. Where the family is coming home. Hell no. If you want your favorite hit comedies in one place, 24/7. It's going down faster than a football player at a strip club. BET Tyler Perry Comedy with House of Pain and the sisters with every day and night. All the laughs, all the heart, all the time. Okay, I like that. BET Tyler Perry Comedy.
Fred, his best episodes are very small.
Dr. Rick Bodor is working on a delicate hand surgery when he gets word that his colleague and mentor, Dr. Stephen Sparks, has mangled his hand in a table saw. Dr. Bodor is now awaiting the arrival of vascular specialist Dr. Matt Menier to help him in this delicate microsurgery.
While we certainly recognize that this is a colleague, really at this point we're evaluating the problem of the injuries rather than, oh my gosh, this is Steve's hand. For the most part, you have about 8 hours from the time of the injury before the injury starts to get compromised by the loss of blood flow.
Because the longer fingers are off with no blood flow, the more death progresses.
It became readily apparent that the index finger was not one that we could salvage. Even with microsurgical techniques, the severity of the injury was too great. And so that was amputated at the level of his first knuckle.
On the small finger, this is what you've seen. It's still dysvascular. We dealt with the fracture.
Having failed to save half of the index finger, Drs. Bodor and Menier must now salvage the 3 remaining fingers, or their their friend's career as a surgeon is over. Having already amputated a part of fellow surgeon Dr. Stephen Sparks' index finger, Doctors Rick Bodor and Matt Menier race against the clock to save his career, one finger at a time.
The sutures are smaller than a human hair. You use a big microscope the size of half a car. The implications of being a little bit off are devastating. In this particular case, the implications are career-ending. I knew that whatever happened that day also, the entire hospital would be totally aware of what happens.
Dr. Keith Bradley has tried everything in his power to convince 90-year-old Sister Della Rosa to accept the breathing tube.
Sister, I want you to understand this one last time. If I don't put that tube in you and put you on that moving machine, you are going to die. Not quietly, not peacefully, but gasping for breath, trying to suck in air that won't be there.
And she looks at me and she does her best to try and get as much breath as she possibly can, and she's got something to tell me.
No. I have been a sister for 70 years, and all that time I've been preparing for heaven. Now, so there is nothing you can say that you're going to make me suffer when I die. That will not scare me at all.
That's why you spend a life of service as a sister, is because that's what's going to get you to heaven. And I sit there and go, okay, you know, yeah, that's right, I got it. And as long as you know what I think the outcome's going to be, then, you know, we're just going to try and help you be as comfortable as we possibly can.
If there's any chance, change your mind.
Doc, the devil will get into heaven before a sister releases the breathing tube.
Take care.
What I'm thinking is that this is going to be the last time that I'm ever going to see this person alive.
But a few weeks later, Dr. Keith Bradley is back in the ER doing what he does best, helping people who want help.
Looks like a broken nose. Let's get a CBC and an X-ray of his nose.
Okay, great. In the meantime, I'll take care of that. You have a couple of visitors.
Who is it? Sister Della Rosa. Look at you.
Thank you. Thank you.
What? For what? You wouldn't let me do anything.
I have to tell you, that was the last person I thought would be ever there to tell me that. I thought her chances of survival were none.
You did. You let me be. And that's what I wanted. And somebody else told me too.
Well, I wouldn't want to argue with him.
By the way, you also owe 500 head mills.
Doc, you might have a lot of medical knowledge and science might have been there and everything else was there, but when you need to know where you stand in the pecking order of things, and if the good Lord wants you, then He'll take you, but if it isn't your time, it's not your time.
Bye, sister.
Where is he in A, did you say?
Yeah.
All right.
While Dr. Chris Mikos is treating a patient with a severely cut hand, a colleague drops by to visit. Then suddenly rushes off.
Just relax. Mark!
But why?
And then I sort of realized that the guy had a knapsack on the floor. And he must have looked at that. Then I hear this commotion outside the room.
Son of a bitch stole my stereo. Try to move.
Dr. Chris Michaels was stitching up a patient with a severely cut hand.
Son of a bitch stole my stereo.
Now the patient is on the run. And Dr. Michaels has no idea why.
See? And I thought, okay, that is my t-shirt. That was scary. Oh, God, that guy punched out your window.
Yeah. I guess he sort of figured, well, if I'm right in the hospital parking lot, even though I got the radio, I might as well get fixed up too. And sure enough, we're just doorsteps away. And he walks into the emergency room and says, I got a bloody hand. Can you please sew me up?
Yeah, my windshield's all over the backs. Yeah. Look, there's a patient in here with a bloody hand. This is my stuff. He broke into my car, punched out my window, stole my stereo. This is stereo. This is my stereo. Took it out of my car. Okay, please, well, here they are, facing down that way.
And we're gonna
It's all my
point
stuff.
out. We need to bag this. Hey, we'll have to sew. Thank you.
Dr. Michaels' colleague has lost his car stereo for the second time tonight.
Don't worry about it. You're not playing anything that great on the radio these days anyway. What?
Hey, guys.
Yeah.
Is this the guy that took your stereo?
Yeah, that's...
Okay, he's not going very far.
Huh? Tony. Tony's left us alone. Okay? There you go. Yeah. Don't worry about it.
The beauty of emergency medicine, and why many of us go into it, is because we treat everybody. We have to have a little break, a little levity, a little something that gets us through the day that makes us human.
Having cared for the thief's hand, Dr. Michaels now turns his attention to another needy patient, his melancholy friend.
There is a banter in an emergency department, and it's meant to break the ice.
Guess what? We won the daily double.
You want
What does it say? You remember about the races? Well, guess what? They can't.
It's meant to bring a little levity.
You ever broken a window? Don't even think about it. Here, come here. Come here. Are we together? We won? Do good.
And this is our way of coping with the tremendous emotions and strains that we feel. And that's what makes an emergency room so unique.
Dry hair? You need moisture. Stop. OGX penetrating oil. Fast hydration that goes deep. OGX.
Joey?
Today, you're meeting for coffee. Make another. And then before you know it, you're meeting the family. At Credit One Bank, we believe having the credit and rewards for the little moments today can lead to even bigger ones tomorrow. Earn up to 10x points on travel and 5x points on dining with the Credit One Bank Wander American Express card. Credit One Bank, for what's ahead.
This is it. One of those moments you'll never forget. Celebrating a true milestone with the people you cherish. Everything is perfect, but it almost wasn't. That's where we come in. We're Lee Company. We'll be there when you need us most. To make sure all your life's moments are ones to remember. We want you to focus on living your best days in your home. Don't worry. We'll take care of the rest.
I need your help. Wanted to have done it to you.
leave our emotions at the door.
Someone needs to speak to the doctor.
Watch Silent Witness on the Silent Witness and Matrix channel. Great guests, great stories, and some of my favorite people.
Incredibly good. Let's go watch it. What's it about?
How do you know that? Because we've done research. Best of our time. Tune in on the Grand Norte channel for non-stop classic noise.
In medical school and residency, there's no training that you receive that prepares you to be in the middle of a gang fight. As a physician, you kind of expect some level of respect and some level of protection so that you can do your job. He dies. All of them. You don't expect to have your life threatened when you're trying to save someone else's life.
Enter Dr. Lang, trauma surgeon.
What's going on here? This guy came in with no pulse, 2 stab wounds in the anterior chest here, got no electrical activity. I don't know what to think. Doesn't look good. What we should call it. I don't think really what to do for him. I got 937 on the code. Okay. Sorry to do that.
You can actually hear the siren from the emergency department as they pull up into our ambulance bay. When they finally approach the waiting room, this fight breaks up and everyone scatters and runs away. Take a deep breath. Walk over to the sink. I wash my hands. Then wash my face off a little bit. Stand up, look in the mirror.
Right down the ridge. Let's take over, okay? This is for other people.
Patients Joseph Wynn and Trey Tran are relinquished to the trauma surgeon to be prepped for surgery.
There's another bed with this little old lady who's sitting there with her, I think her index finger with a band-aid around her index finger. She's been sitting here this whole time with this just mayhem ensuing, just with this look on her face.
So sorry about the wait. Sorry about the wait. Now where were we?
And I walk over to the bed and I go, "Excuse me, ma'am, I apologize for the wait this evening. What can I do for you?"
Two young doctors work through the night to save the mangled hand of friend and fellow surgeon, Dr. Stephen Sparks. It is nearly 2 a.m. when Drs. Bodor and Meunier finally complete the delicate reconstruction. The surgery is done, but the patient is not yet out of danger.
At the end of this operation, you have to leave the table knowing you've done all you can do. You've salvaged all that could be salvageable.
We've already started planning on how we're going to try and improve function if it turns out that he's unable to regain full function of his hand. We decided to keep Steve in the hospital so that we would know the blood supply remains intact.
Both Matt and I have this congratulatory feeling that good job, thanks for your help, good effort, and let's see what he does now.
12:30 the next morning, I wake up and I can't tell what my hand is because it's in this massive bundle. I did lose the index finger and a good portion of the ring finger, and they reimplanted the little finger, but they're unsure of what function it's going to maintain.
He's got to not have anxiety or stress or pain.
We want to keep as much blood flow going through the fingers as possible.
And that little 1 millimeter vessel, the size of a pencil lead. So sew them together with human hair, kind of stitches. If it gets a little vasospasm, it could clot and the finger dies. Hey there, guys. Good job. All right, excellent. Good. Well, how you doing?
Good. That's kind of low.
We got something for you. It's a little mangled, but I think that you guys can work this out. He's positive, and he's thankful and grateful. And we have a good discussion about how we did it. Very nice results for him so far.
And therapy is a lot of work.
Now it's his turn.
Back in the operator.
Well, I know that the majority of the nurses, all the OR staff, the ICU staff, everybody just really treated me well.
Oh, all right.
Yeah.
That's okay. Good.
Okay, ready?
Yes.
Say microsurgery.
Microsurgery.
Okay, are you ready?
I'm ready.
Excellent. Go. Almost a year to the day, I returned to the operating room. The biggest thing I learned is that there's always tomorrow, and when it looks like there's no way out, if you just continue to work at it and continue to struggle with whatever it is, whatever the injury is, whatever the circumstance is, it'll work out.
I love The Price is Right. We love to hear that.
They're sure. Say it all.
I'll bid for Bob. You're not bidding for Bob.
But sometimes you just have to ask.
Now, I have seen strange shirts in my time.
What are you wearing?
You four have got to stick together because walking with is on your chest is ridiculous.
What will they wear next?
Watch The Price is Right, The Barker Era, now streaming free on Roku.
Escape into a world of endless beauty, with breathtaking landscapes and awe-inspiring views awaken the senses. Make time for yourself. Tune in and unwind with gentle melodies. Travel to faraway lands with stimulating nature escape. Your window to the world.
Blackback someone says nothing.
Hell of a time to call me back.
Stop calling names. We need help. Why did you bring the Black History? So what are you saying?
They're all our prisoners. And from this point forwards, this is our outpost.
I never pictured myself being caught. Torture interrogation center.
Al Qaeda prison.
If I knew what I knew now, I would never have gone to Bolivia.
We've been carrying the pot across the border ourselves.
Cocaine trafficking.
Drop me over.
Thank you, Johnson.
It's that decision that I regret it every single day.
see a 30-something-year-old now who was symptoms of stroke. And who are you, ma'am?
I'm his girlfriend. Are you Juan's sister? No, his sister. I'm his wife.
And I was thinking to myself, really? Really?
We probably gone to 5 minutes hot off so we can let him out. Oh my gosh. You and Iraq.
He was charred black from the blast. He had no legs. His legs were gone. He was lifeless. Guys, I got no pulse.
Nothing.
Start CPR.
Tell me how you got bit. My daughter bit.
She's 3. She didn't get the arm.
I saw the typical bite mark with a few punctures from where the teeth are on his cheek.
I think it's getting worse.
Within minutes, I could see the infection spreading out much faster than I've ever seen an infection spread.
You see my forehead? This is what I go through when it's 64, 65 degrees inside, no t-shirt on, and it's September, after dark. This is part of my research with Medigo, amongst other things.
It helps keep me very grounded in what I do, and it influences who I am as a physician.
Pay attention to what I describe. I took my propane. That much is in me. Hours ago. I went to go to bed early, but nothing. Nothing will restore my life to you. I might tell Dr. Roger Hill, CEO. Famous Study. Holla at him. Show him these things. Made this particular video. I do a lot for my son, my nephews, and those who truly deserve to get my stuff.
I was really concerned to see a 30-something-year-old male come into the hospital with symptoms of stroke. Usually that's something that's reserved for our older population. So when I saw that, my level of concern went up immediately.
All right, you see him? Just the cabinet. He seems normal.
Okay. Juan, are you allergic to any medications? I went ahead and examined him, and his exam, his lower left side of his body was flaccid, meaning he could not move at all. He couldn't lift his left hand at all. He lifted up his right hand and squeezed my hand very hard. Usually within the first 3 hours of a stroke, we can do some interventions, and that's why I need to get you to CAT scan right away. I called a charge nurse and I said, please call the CAT scan machine, because with that timeline of only 90 minutes and his symptoms being so profound, you start thinking about potentially using TPA, which is our clot busting medication.
10 minutes.
Great, I'll let him know.
Where's she going?
I don't know.
Hi, are you Juan's sister?
No, not his sister.
I don't usually make an assumption about who people are, because when you make mistakes, you're embarrassed. But I was already set up in the sense that I had already met his girlfriend. I'm his wife.
ER physician Dr. Todd Baker will tell you there are certain memories that will never go away. And that's not hard to understand if you know where he's been. A combat hospital in the heart of Baghdad. This is where Major Todd Baker and his staff look death in the face every day. And on one particular day, they may just have cheated.
We've been receiving a lot of trauma and have been moving at a considerable clip during that time. And then this day, we heard that casualties were returning in.
This is Eagle Med. Copy. 2 urgent surgical. What's your ETA? Over?
Deb Chappelle is the GPR. So far, she served 5 months in a big Iraq tour in Iraq.
I had actually seen trauma before because I had worked in a trauma ER, but to just sit there and think, oh my gosh, I'm really in Iraq. And then you see this soldier come in with injuries that you thought, oh yeah, I've seen trauma before, but you've never seen trauma like this before.
For ordinary traumas, the first hour is what makes the difference between life and death. But the victims of today's roadside bomb are barely clinging to life.
What we got? IAD, double amputation, heartbeats in the 130s. Let's go to bed one, guys.
And Dr. Baker knows how little time they have. About 15 minutes.
All right, on my count, we're gonna move. 1, 2, 3. His body armor had been removed. He was pale, unconscious. And as they laid him into the trauma bed off of the stretcher, you notice he had no legs from about mid-thigh down. His legs were gone. And bone, muscle, tissue, he was charred black a little bit from the blast. He was lifeless, essentially. Give me vital signs when you got him, guys. For every amputated extremity, we would give 1 code red.
Code reds are pre-measured kits for supplying blood to critical patients.
They were 6 units of blood product, 4 units of packed red blood cells, 2 units of fresh frozen plasma. We used a lot of blood when we were there. It was our primary fluid that we would give in trauma. Among the most important the reason we have such a high survival rate is the tourniquets. The body armor, as far as these blast injuries and explosions, stops the shrapnel. And so they'll come in, they'll lose an arm, lose a leg. Well, that's where your tourniquet comes in, because every soldier, Marine, airman, and sailor over there have tourniquets on them, and they save lives every day.
5 precious minutes have passed since the chopper landed.
Oh my God.
Doc, he's got massive tissue damage to both legs.
During this time, a second soldier was being brought in to bed beside us, and he also had pretty bad wounds.
Hey, buddy. Okay, let's move on.
If you're an outsider looking in, it looks like horrific chaos. If you're a member of that chaos, it's a controlled chaos. It's a chaos that we do well in.
The second wounded soldier barely hanging on. The first soldier takes a turn for the worse.
Guys, I got no fault.
Nothing.
Start CPR.
At his big city hospital ER, physician Brad Kaufman is responsible for overseeing emergency paramedics and firefighters.
Great job.
I love working with the paramedics and EMTs and the firefighters and the police on the scene of actual emergency. It's extremely exciting. And I feel like we're doing something extremely valuable to the people of the city.
And in the ER, Dr. Kaufman sees his share of excitement every day.
Next.
Sometimes it's least expected.
Bam.
I am 3 years old. This is my daughter.
Okay.
And the patient just had a liver transplant.
If I break the skin?
Yeah.
Often we see people with bites, often children who playfully bite each other. And certainly we're concerned because a bite by a human contains a lot of bacteria.
See it right away. Before? I'm Dr. Kaplan.
Went into the room and it was a young man. He was surrounded by many concerned family members.
Doctor, he just had a liver transplant.
2 months ago. It's okay, Mom. I'm gonna be okay.
Corey, tell me how you got bitten.
My daughter, Baron. She's 3. She didn't mean any harm. We were playing monsters, and she accidentally fed me a little too hard, that's all.
When I looked at his face, I saw a typical bite mark with a few punctures from where the teeth are on his cheek, with a little bit of surrounding infection, redness, swelling.
Corey, can you tell me exactly what medication you're taking?
It certainly caused me great concern, because in this young man who's on strong immunosuppressants to try and prevent the rejection of this
liver that was transplanted, this infection could spread rather rapidly.
Are we going to start an IV, please? 600 milligrams of clindamycin. Anyone on monitors. It's a good thing you came in right away. Get you on some antibiotics and keep an eye on this thing, okay?
Okay. Hi, Corey. We're gonna have to get you shut off here.
I think it's getting worse.
We noticed that the swelling and the redness, signs of infection, were becoming quite evident around the bite. And within minutes, I could see that the infection spreading out from that area much faster than I've ever seen an infection spread.
I'm going to draw an outline on your cheek, Corey. Yeah. We'll see how much it might be spreading. I'm going to get you an oxygen as well, just to be safe, okay? James, I need O2, please, with a cannula. Who's your surgeon? Who performed the transplant?
It was Dr. Farrell, I think.
Doc, blood pressure, 170.
Blood pressure is actually going down a little, which is concerning for an infection spreading throughout his body. So we started giving him fluids to try and get his blood pressure to go back up.
Okay, let's start a second IV.
Pulse is up, 95. BP, 98 over 65.
Just get those fluids in right away.
We saw this infection actually spread throughout his cheek and creeping along his face, which caused great fear that this infection was really just taking over and moving extremely rapidly throughout his body.
I went in to speak to the patient, and there was another woman there.
Hi, I'm Dr. Jasper. Okay, and you are one step away.
A transplant patient who's on immunosuppressive drugs is under attack by the bacteria from a toddler's bite.
BP's 92.
Vancomycin, 500 milligrams.
As the infection spread from his face and into his neck, you could see the redness and the swelling actually progressing to the point where his face was becoming deformed. It was really taking over his body, this bacteria.
It takes a while for the antibiotics to do their job. Stronger antibiotics, this is what we're doing now. We just have to wait and see how things progress.
You could see the anguish in his face because he was so upset that his child might have been the one to cause this patient to die.
I'm having trouble breathing, Corey. Excuse me. Keep watching. I'm going to go call the surgeon.
Why is he having trouble breathing?
The swelling that's constraining his airway. Doing everything we can.
Thank you. Doc. Is he gonna die?
The infection's spreading much quicker than I'd like to see. They just started antibiotics. I'm really hoping they'll catch up with him.
Sorry. Babe. Suppose we're getting married. Who's the best man? She didn't mean to do it. She was only playing.
Of course you did.
She was recovering so well.
It's good. Means he's strong. Paula, I need you to find a Dr. Farrell and Metro, please. In fact, get a hold of him for a page and let me have him.
Doc, this meeting's getting long.
Yeah, please. I need a Dr. Farrell. Please be there.
About 10 minutes later, it had completely spread through his face into the airway and neck that caused this critical obstruction of his breathing.
Okay, Corey, I need you to try to stay calm, taking full breaths in and out for me, okay? Open wide for me.
When we looked in to see the airway, you could see that it was worry, we're gonna need to get you in a respirator right away. Let's get him to a resusc space, stat. What? Folks are gonna need to step out for now. Just wait in the waiting room and we'll get back to you. He's going into septic shock. Let's go, guys, let's go.
Dr. Nicole Jasper has just learned that her patient's girlfriend has some competition.
No, I'm not his sister. I'm his wife.
I kind of just looked at him like to say, oh, it's going to be one of these. Clearly,
I'm Dr. Jasper. Nice to meet you.
I'm Carmen. Unfortunately, it appears your husband's having a stroke.
A stroke?
When was the last time you saw your husband?
About 3 hours ago when you left for work. He was fine.
Okay, we'll get him over to CAT scan, and then once I have the results, I'll come back and speak with you.
How long will that take?
Maybe about 30 minutes. By this point, it was like 11:15, 11:30ish, and she said, well, we have a child who's in pre-K, and the pre-K program here only lasts half a day. You know, I'm going to go pick up our daughter, and then I'm going to come back. Is that okay? And I said, that's fine. We got him over to the CAT scan machine. And I went and looked at his CAT scan, and it looked normal. We didn't see any signs of bleeding.
That means we could probably do TPA with her.
We have to get consent, because clearly there are pros and cons to this medication. Do you know his lifespan?
So I went in to speak to the patient, and there was another woman there.
Hi, I'm Dr. Jasper.
His name is Fernanda.
Okay, and you are?
Florence girlfriend.
Guys, I got no pulse.
In Iraq, Dr. Todd Baker and his team are racing the clock to save the victim of an IED attack. The soldier lost both his legs. Now his heart has just stopped beating.
Everyone know her now. The majority of the time when people need CPR, they still suffer brain death and brain injury, and this soldier didn't last very long. I've got a pulse.
I've got a pulse.
All right, that's intubate. At that moment, we're thinking this kid's got a chance. There's no time for emotions while it's occurring, but he goes from despair to elation. We've got a heart rate. He's back, and so that's elation. That's what we're there for. Where's the surgeon?
I'll check.
8 minutes have passed. About 7 left. Dr. Baker moves to the second casualty.
He still has his femur and bone were intact, so it wasn't a complete amputation like the first patient, but all the muscle and tissue and everything was gone behind the bone. And he had massive blood loss, so we kind of described that as a shark bite type injury.
Meanwhile, a second chopper is landing outside. Deb Chappelle hears it arrive. No one else does.
I was back in the office, heard a chopper, came out to see what was going on, and everybody was in the trauma room taking care of those two patients.
Unaware of the new arrival, Dr. Baker fights to save the life of the second soldier.
He needs blood, no question about it. And so the first thing you do is get an IV somewhere. Okay, code red.
Any more red cutting?
Better not be. He was wide awake, and I remember he said, you know, I hate you. Which actually is a good sign. You know, that's what we want, because that means he's with us and he's doing okay.
11 minutes in, Dr. Baker is still completely unaware of the second chopper.
Blood is going into both of these guys. When I step out of the trauma room,
Are you heading to the treatment room? The floor. We're just landing. We've got another urgent surgical.
I was one already. We need backup. That's when I knew we were in real trouble.
This is a problem. How do you control your blood pressure when you're living a life like that? You are very sick. You don't need all of this stress. You could just see the horror on his face. Literally, it was horror. Are you saying yes to the dress? You look stunning. Wow.
This is my dress.
every day on Earth Day 365.
Welcome to Stingray Cityscapes, a channel that takes you around the globe to the sound of relaxing down-tempo music. Visit the world's most iconic urban destinations from a soaring bird's-eye view. Tune in to Stingray Cityscapes, where every skyline tells a story. Dr. Kaufman's bite victim is nearly suffocating from the swelling in his airway.
Push 20 milligrams of etomidated, 100 milligrams of succinylcholine.
Got it. We were able to pass the endotracheal tube carefully through his vocal cords to be able to secure the airway before it completely closed off.
Okay, let's hit a central line in the...
Neck?
No, femoral. Come on, Corey, stay with us here.
We knew the infection was spreading throughout his bloodstream because his blood pressure continued to drop and his heart rate continued to go up.
Let's see what his kidneys are doing. Let's capture them.
With all the interventions we were doing, we were trying to keep him alive long enough for the antibiotics to start working. So this was really a race against the clock.
We're not getting any urine. There's no blood flow to the kidneys. Damn it.
I've got the surgeon, Dr. Farrell, on the line.
I can't talk to him right now. Just let him know what's happening.
60 over 30.
Corey, stay with us.
Speaking still dropping.
Dr. Jasper has just learned that her patient has a wife and 2 girlfriends.
I'm Dr. Jasper.
I'm John.
And you are?
Oscar.
I looked at him and I was like, oh my goodness. I said, well, when was the last time you saw him? Because at that point I was just being nosy.
I saw him last night, Tuesday. Where could you talk?
He's had a stroke. So he clearly had seen all of these women in like a 12-hour period of time, all 3 of them. And I was thinking to myself, really? Really?
Just pick one. One. Just one.
Yolanda, I'm going to ask you to just step out of the room for a few minutes and wait in the waiting room.
Why?
I just need to speak with Juan privately for a few minutes. We'll come back and get you if you don't mind. I mean, how do you control your blood pressure when you're living a life like that? I said, look, this is about to get ugly because clearly I've already seen 3 women here, and if you think that they're not going to bump into each other, you know, during this day, whenever, you're confused. He kind of just looked at me and, you know, he put his head down, but I'm just telling you, this is a problem. You don't need all of this stress. Okay. Calm down. I will be right back. They're yelling at each other, and I'm like, okay, so these women know each other because, you know, I would have at least thought if he was going to be that close, they shouldn't at least know each other. They should be strangers. You better call security.
I did.
They call security. Security comes, and I'm like, they have the girlfriend step out because in reality, you know, in these situations, family's supposed to be there. Whatever's going on, she was still his legal wife. We have the CAT scan results, and I need to speak with you and Juan about treatment options. Okay?
Dad, good thing you're sick.
We step back into the room, and she's like, you know, it's a good thing that you're sick, because if you weren't sick, I'd probably kill you right now.
And I'm glad you can't talk either. That way you can't lie, you bastard.
Okay, here's the deal. Given the fact that these symptoms all started less than 90 minutes ago, and the fact that Juan's CAT scan results are normal, I think that Juan's going to be a candidate for something called TPA, which is our clot-busting medication. But there are risks.
What are the risks?
TPA thins the blood, so there is a chance of internal bleeding. But the neurologist and I have discussed it, and we both believe that Juan could really benefit from this medication. She's like, do whatever you need to do to make my husband better, you know, and he seemed to understand what we were saying, and I said, you
getting to, and it's another soldier who's lost one leg. No medics and no one else to help take care of him.
It's okay, we're gonna take care of you, all right?
Did you call for help?
I couldn't. Everyone was too busy.
Bear is a superstar. Anytime that was needed, she was the first one to jump into the fray and help out.
You don't have time to wait. In an ideal situation, you have one medic assigned to monitor, one medic assigned to oxygen, the nurse is in there to do the IV, and someone is cutting off the clothes. So when I'm by myself, you still are trying to do all of that. You just can't do it all at once because you're only one person.
You're going to be okay, buddy. We're going to take care of you. You allergic to any medications? Going into a situation where it was just Deb and I with a critically wounded soldier was very intimidating and scary.
Less than 5 minutes remain in the 15-minute survival window. Their only support, an admin clerk with no medical training.
We drafted her quickly.
Do we have a date?
Put this down, start cutting, and have her start cutting clothes off as fast as she could to expose the patient so we can figure out what we need to do to get access. She had never touched patients before, but she instantly became a medic and part of the team.
And still need more help, and fast.
Across the room, a fourth patient was brought in with injuries to his head. You could see he was bleeding. That's all that Deb and I needed to know that he was okay for the time being. Hey, medic, need oxygen launcher right now. This medic was not one of our medics that usually work with us. He was a new medic who had just arrived earlier. He was a little bit shell shocked. 75 over 40. And this was his first real-time experience. Lisa, I need a target right there, right now. The patient needed blood right away.
It's gonna hurt a little bit when I lift your leg up here. Sorry, man. We'll take care of you.
You know what code red and a rapid user is?
Yeah.
Go to trauma room now.
3 minutes to go.
I need a code red and rapid infuser.
The code red was a system of getting blood into a patient quick because it was already prepackaged. And the typical cooler that you see back in the States to take to a barbecue, that's what we had. If you saw somebody running around with one of those coolers, it was probably because it was a code red inside there, coming down for a trauma.
Deb, I'm just going to have to put the line in.
Okay. I got pain meds ready.
I immediately went to his groin with one of the large central lines that we use. Didn't have time to give him anesthesia. He needed blood right away. This is going to hurt. It's not hanging in.
Less than an hour ago, Dr. Kaufman's patient walked into the ER. Now he can barely breathe.
Despite the fact that we were giving him compressive fluid to his veins and we were giving him the strongest antibiotics, taking over his breathing, his vital signs just continued to deteriorate. And I was really concerned that he might not survive.
I gotta give him pressors.
What about his liver?
Gotta risk it. It's his only hope. Norepinephrine in the central line at 5 micrograms per minute.
It was really a life and death decision at that point to start the pressor medication. This medication is given in critical patients where their blood pressure is too low.
I know time to nap.
I was concerned about the effect that could have on his blue liver as well as the side effects of the pressor itself, but I knew we had to do it or he wouldn't survive.
Still in here?
The suffering that this family was going through, taking into account all they had gone through in the past months with the liver failure, and he successfully went through this transplant operation. They had worked so hard to nurse him back to health, only to see him come crashing down at this moment.
Here's what's happening. We're in a critical condition. Right now there's a war going on inside between the infection and the antibiotics. Right now the infection is winning. We give him a very powerful drug called Pressor. His blood pressure back up. It's a dangerous medication for him because of his new liver, but it's his best chance. How we want that antibiotics to try.
How long will it take?
Can't say. But I can't bring one of you in the room. There's room for only one.
You go.
life, limb, and eyesight are the top three things you try to save in an ER. Obviously, life is first. If they lose their eyesight, but you save them, if they lose a limb, but you save them, then you've done your job. A lot of these soldiers, we just can save limbs. You want to accommodate the sucks, right?
It sucks. Let me know what's in.
Okay.
For Deb Chappelle, surviving means keeping an emotional distance.
I did not want to know their names. It was because I needed read. I mean, I was the head nurse. I was the mom. And to see these kids come in it was too real. And so for me, it was easier to just focus on the patient, focus on the life that we could save and get them out and move on to the next. Because there was always going to be a next one. Going to sleep. Okay, blood pressure's coming up and the heart rate's going down.
Once he was stabilized and getting blood, his vital signs were getting better, and he was unconscious out of pain. Rotated over to a fourth soldier who had minor wounds to the head and fine. Blood did his job, my friend.
In spite of being caught off guard with 3 critical cases, Dr. Baker and his team had no deaths to report.
We had gone through 36 units of blood in under 20 minutes, and 3 soldiers. Literally a foot-wide streak of blood all the way across him.
Dr. Nicole Casper is finding herself in the middle of a feud between her patient's companions.
My nurse, she like grabbed my arm because at this point my nurse didn't know what was going on. And her mouth just dropped open and I was just like, here we go again. What are you doing here?
What am I doing here? What the hell are you doing?
You could just see the horror on his face. Literally, it was horror.
I brought him here. Oh, nice. You were with him when this happened then. What do you think? Where do you think he was? At work.
Please.
Where he said he was going
And because he was on the monitor, you could see his heart rate starting to go up. Okay, really? I need this to stop now. This man has had a massive stroke, and his blood pressure is going way up. I need you both out of here.
See what you're doing to him? You know what?
His increased blood pressure would potentially make the situation more detrimental because the higher his blood pressure goes, he could continue to have what we call an evolving stroke, where his symptoms could actually worsen. Let's get ready to start the CPA. One, I need you to try to calm down for me, okay? Let's get a 7 milligram bolus start. One, some knives, the security officer came up to me a few minutes later and said that all 3 women were out in the parking lot arguing. One of the women had thrown herself in front of the other woman's car, and they were yelling and cursing at each other. They were acting less than honorably, is the word that I will use. I thought out of the 3 of them, the wife clearly was the most angry. Like, I thought that she physically might do something to one of those other women. So we were concerned about this turning into not just a verbal, which it was, altercation, but a physical altercation. And nobody wants that to take place.
You too. Why didn't you come and speak to me, huh? Talk to me like a real woman. Huh?
This is like Jerry Springer.
Dr. Kaufman's patient is losing the fight against a raging infection. His fiancée has come to be by his side.
However, BP is stabilized. Actually, it's coming back up.
Right. Good. Very good.
It's feeling good.
Not yet. Depressing medication. It's a good sign, but not yet.
Can I hold his hand?
That'd be a good idea. Why don't you talk to him?
Corey, come back to us. Corey. Corey, if you die, I don't think you will have to live with it your whole life anymore.
will never forgive himself. Don't you want to marry me?
We've got your result. Kidneys functioning.
Heart rate's coming back up.
Fantastic. Once those antibiotics were able to circulate and catch up with this spreading infection and fight back, they were able to do their job of preventing this infection from spreading further. To this day, I've never seen an infection that moves so fast throughout a patient. He was moved up to the intensive care unit where these treatments were continued.
Thank you.
You're welcome.
He's gonna make it.
This particular case really made me realize how important it is taking care of patients every day. It not only affects that patient that's in front of us, but their family and community as well.
Oh, oh, Dr. Kaufman. Little girl left you a present.
The battalion commander arrived shortly afterward and told him about all four of the soldiers who were injured. They're all in surgery. They're alive. Survived. All of them?
See where he's lost.
I couldn't imagine. You know, those are his guys. Those are the guys he's responsible for.
Within 15 harrowing minutes, Todd Baker and his team have saved the lives of 3 critically wounded soldiers.
The battalion commander arrived shortly afterward, and I told him about all four of the soldiers who were injured. They're all in surgery. They're alive. Survived. All of them?
See where he's lost.
Arms, legs?
Gunner lost both of his legs. He was coding when he came in and did CPR.
We got him back. Hopefully there wasn't any brain injury, but he lost a lot of blood. Yeah. I can't think of anything greater as a physician to do than to deploy to a combat environment and take care of the men and women who are there. Great job, Deb. Thank you. We ran out of personnel quickly, but adapted and utilized the system that we had fallen into when we first arrived at Baghdad ourselves that had already been put in place, and it absolutely works flawlessly.
Dr. Baker returned to his practice in the States, but his experience in Iraq is one he'll never forget.
Every time I see a wounded soldier, it tugs at my heartstrings because I say, wow, that's a dad, that's a son. You know, I see the after effects, and I say, I wonder, you know, did he come through our doors? I don't know who they are, but there's men and women in the U.S. today that are alive because our team was there, and that's the most satisfying thing I could ever do.
One of the things about emergency medicine is you don't always get to see the end result. And so when they stay in the hospital, I like to go and visit my patients.
Doctor.
You can talk.
Yeah. Look.
Excellent. I'm glad. Go on, listen.
I already know what you're going to say.
Honestly, 3 women? It's no wonder you had a stroke. Is that really working for you? I didn't want to come across as being very preachy, but I did have to give him my opinion on that since I did get pulled into it. Usually I don't give my opinion, but I gave my opinion that day.
Love them all.
Don't you think that's kind of selfish? I mean, you do have a child.
Maybe it is, but particularly the one. It would kill me.
Having all of them almost did kill you. If you don't die from a heart attack or a stroke, one of them might kill you.
Yes. Happily.
This is it. One of those moments you'll never forget. Celebrating a true milestone with the people you cherish. Everything is perfect, but it almost wasn't. That's where we come in. We're Lee Company. We'll be there when you need us most. To make sure all your life's moments are ones to remember. We want you to focus on living your best days in your own. Don't worry. We'll take care of the rest.
Everybody struggled last year. Hopefully we can recover. Every little thing is as good as gold. Drug trafficking and murder for hire.
It's still on time, detectives.
You're joking, were you?
You think I was over and I have more sense?
I want you not to let sweets to you.
Unsolved crime case squad.
Don't you get smart with me. Still got it.
Watch New Tricks on the Silent Witness and New Tricks channel.
Ready for this?
I was born ready. On America Says,
I don't like blank on my sandwich.
when you fill in the blank,
Ketchup, pickle, onion, mustard, mayonnaise.
you take your team to the bank. Join host John Michael Higgins for America Says. Watch full episodes on Game Show Central.
These are the real stories of the ER that doctors never talk about.
This one here is a finger danger. We didn't get it out right away. He was a bit defiant, he had a bit of an attitude. I'm Dr. Bill, we're here to help you.
She had her eyes open with a look of fear. We were at a hotel together, all of us. Then Kelly started having trouble breathing.
Doc, you're not going to believe this. This was something else. Oh my God! I saw blood squirting probably 2 feet. And I just thought, this man's gonna die.
These are the untold stories of the ER.
Thank you. We can discharge that patient.
ER Dr. Murdoch Kalegi is always happy to lend a listening ear.
So anyway, after the speed dating didn't work out, my cousin put me on a dating website. What a nightmare.
I'll have to take your word for it. One great thing about this line of work is it's an opportunity to learn something new every day. Not just about medicine, but about people.
They lie about their age, their height, their weight.
And of course, you were completely honest.
Why would I lie? I got what they want.
All that and modesty, too.
Then I met a beautiful woman and she had so much baggage. I'm telling you, Kalegi, it's a jungle over there. We brought SLB here.
Trauma Bay 2. Back to work. In the emergency department, SOB doesn't mean what it usually means. It means shortness of breath, which is one of the most serious things you can see in the emergency department, because if someone stops breathing, they stop living. I quickly go see the patient, and can see that she's gasping for air, and she can barely maintain her breathing. I ask the paramedics if they know anything about her.
What's the story? Mrs. Kelly, age 29. Her friends called 911 when she had trouble breathing.
It looked like she may have been out at a club or was planning to go to a club.
Well, Dr. Kalegi, have you ever had any trouble breathing before?
She had her eyes open with a look of fear, but she couldn't gesture. She didn't have the strength to speak.
You been drinking alcohol or doing any drugs? Do you have any medical problems? Let's get blood, chest x-ray, tox
stop breathing and not survive. The first most important thing was to stabilize her. So what we did is innovator. There's a lot of mucus here, I need suction. When I looked in her mouth, there was a massive amount of mucus. So I quickly grabbed the suction and sucked out as much as I could, as quickly as I could. We took a tube and put it down her throat and hooked her up to a ventilator so that she could breathe, because she clearly wasn't able to breathe enough on her own and was going to quickly tire her out. Once the ventilator was connected, she was breathing adequately. She was getting enough oxygen.
Get a chest x-ray.
Any theories on this?
I wish I did.
The initial test didn't give us an obvious answer, so we did a quick x-ray both to check the innovation and also to check her lungs to see if that would give us any clues.
It's clear. ECG's normal. No medical history. Blood work still pending.
Dr. Kalegi, there's something you should see.
When the nurse was putting in a catheter, she noticed something. I was extremely surprised.
Okay, that's not what I was expecting.
Here we are. A lot of people count on Nurse Terry Foster.
I missed the order.
Let it take your break.
I just want to get this done before I screw it up.
I know, but you're doing fine. Just relax, take a breath, and take it easy, okay? Okay.
Thank you.
The ER is about one of the most challenging places to be a nurse, but I love it and I've done it all my life.
Hello.
There's always something new to learn every day. I don't think I'll ever be able to say that I've seen it all. I was working one night in a small county hospital, and there was a terrible storm going on, and we kind of were gearing up because we thought we might get a lot of accidents because the storm was really treacherous. And then we had a patient who came in for a rather unique reason to come to the emergency room. Hi guys, my name's Terry. I'm a registered nurse. I'll take care of you here, okay? Come on back. The man came in because he had just had surgery on his carotid artery the day before, and he was feeling really bad. Did you all happen to call the surgeon that did this?
No, we were going to go back to Mercy Hospital, but I couldn't drive that far in this weather.
I don't blame you. A carotid endarterectomy, which is the surgery he had, is kind of like doing a rotor-rooter to clean out their carotid artery. This man had a history of hyperlipidemia, which is a high fat content in your blood. It's usually hereditary. How did your surgery go? Look. Okay, good. I got you. It's okay.
He's been throwing up since we got home.
I saw you're on Vicodin. Have you been taking that? They said it might make me a little sick. Yep, it'll do that, for sure.
Keep any food down, and he's been sweating like crazy.
Okay.
Terry, do you need anything?
Actually, you can probably get an IV in him. He's gonna need one. I'm just gonna look at your incision real quick, all right? Just a little bit of a pull here on the tape. I was concerned about the patient because he just had surgery the day before, so I wanted the doctor to come in and check him out. Hey, Doc, can I get you to see this guy in room 3? He's a post-op carotid endarterectomy from yesterday.
Red level, MBA. First person here, second one down in C. Why didn't you guys call first? Control one.
Before I could get the doctor in there to see the patient, the ER just suddenly got really busy.
All right, ready? On 3. 1, 2, 3.
Terry, I need your help.
Really?
Yeah.
I'm a little busy here.
TikTok Radio is the perfect place to listen to the top TikTok songs living rent-free in your head. From your For You page to your TV screen. Enjoy all your favorites and more on TikTok Radio. Start streaming today.
This actually could be one of the finest things we've ever had on the anti-switch show.
Here we go. This is a quality piece.
It belongs to Queen Victoria herself. Have you ever thought of what they might be worth? I would say that's about £4,000.
It's a quarter of a million.
Look at the shop.
shift. For sharks, sharks, and more sharks has arrived. It's all sharks, all the time.
You weren't chosen because you are enough. You made it. I see so much raw potential.
This is your moment.
Nothing else like being a WWE superstar.
And no hiding from this week. Dr. Aaron Billen is used to dealing with some tough customers. Rodeo is a way of life here. We see a lot of injuries during the rodeo season.
Spotted cold and made for
Spotted pussy. There is a Western culture, Western lifestyle. Hi, I'm Dr. Billen.
Hey, Doc.
This is Keith. I'm Megan.
What a rash you got there, Keith.
He's had it for 2 weeks. I've been telling him to come in. Scratch him like a
I don't doubt it. These cowboys and cowgirls are as tough as nails. They come in, not when they get injured, but hours, days later when they can't bear the pain. Did you come in contact with anything in particular before this came on?
Vinyl.
He works on an oil rig.
Yeah, the one on that double rig. How could be this new skin cleaner they got in season?
You seem to tell me the story, but every other word was vanity.
It sounds like don't give a flying about our health, I swear to God. Now, Keith, we're gonna get you taken care of, but I'm gonna have to ask you to be careful about your language over here. You kidding me, bud?
My only response I could think of at the time was, no, I'm not kidding you, and my name's not Brendan. At which point, he tore off the blood pressure cuff, left to his feet, and said,
You're not gonna tell me how to up.
Keith. At this moment, the sheriff came through the doors of the emergency room with a patient who would normally come with an ambulance.
Going home.
Keith, do this with me. The cute phone of the deuces.
That and some urticaria. Howdy, Sheriff.
Doc.
What can I do for you?
Something the matter with that kid. Why?
It became very clear that he was very confused.
I've never seen him like this. I've known Hank for years.
Well, hey, let's get you sit down in this wheelchair and get you taken care of.
The sheriff told us that he had come to the sheriff's department to report some coins from his collection that had been stolen. And while the sheriff's department became increasingly more confused, he actually collapsed to the ground at one point.
Last horse broke your legs. It wasn't making any sense.
We got this. We'll keep you posted.
Thanks, Doc. Copy that on my way.
So we need you to put this gown on.
No gowns. We're no rodeo clowns.
How about you just rest on the bed?
As most retired cowboys are, he was a defiant, he had a bit of an attitude, and no woman was going to tell him. I'm Dr. Billen, we're here to help you.
No.
Why don't you just have a seat? We'll get you checked out. See if we can make you feel a little bit better. When a patient has altered mental status, there's a whole number of conditions that can be causing the patient's state. Things that are imminent threat of death, things that are a little less urgent, things that are not as much of a concern. It could be simple developmental dementia, which is age-related.
Lightning scares her. No, I ain't leaving her.
Hank, we're not going to hurt you. He was pushing our hands away, resisting efforts to take his vital signs, wanting to climb out of the bed.
I ain't leaving her.
I knew these two women had to be linked somehow. What I wasn't sure of was what the link was.
Excuse me, ladies?
Now I'm hoping I can figure out what they were doing that night.
We're at a hotel together, girls' night.
And then Kelly started having trouble breathing.
Alright, ready on 3. 1, 2, 3.
Nurse Terry Foster is looking after a patient and a nurse in distress.
Terry?
And the doctor is too busy to help.
Terry? What? I need your help.
I'm a little busy here.
Go see what she wants.
What?
I can't place the IV. I can't find the vein.
Okay. I'm sorry. Got a little busy out there. All right, I'm gonna need your right arm here, buddy.
You'll be okay, sweetie.
Send him off? Just gotta find a bank, okay? What if you can't? Often patients with hyperlipidemia have really bad veins. Needed an IV for some IV fluids, but I just couldn't find a vein to put the IV in. Okay, looks like I got one here. Okay, man, there's gonna be a little stick here in your arm, okay? Okay, we're in. And I'll see if I can give him something for the nausea. Okay, I'll talk to the doctor. I'll be back. Thanks. Hey, doc, that post-op in 3, the carotid, can I give him something for vomiting?
25 milligrams Finnegan, that'll help with the vomiting.
Okay, IV?
Yeah.
Okay, thanks. Phenergan is good for nausea, but it can also be really hard on some of these veins. It can cause the veins to become red and to leak, and sometimes you lose the IV. I was hoping that wouldn't be a problem later on, but we really needed to stop him from vomiting. This medicine will kind of relieve your nausea and help you to kind of rest a little bit. You might even fall asleep, okay? I'll just fix your pillow for you here a little bit. You can kind of lay back. There you go. I'll go talk to the doctor. I'll let her know what's going on. If you need something, give me a holler. But we'll take good care of him. I know he's not just a patient. He's your husband, okay?
Thank you.
Okay, you're very welcome. Holler if you need anything. He seemed to be feeling a little bit better, but I still needed the doctor to come in and check him out. So I left him for a few minutes to kind of check on some of our other patients, when all of a sudden, sometimes the less experienced nurses get really freaked out at some things that I've seen, but this was something else. Oh my God!
Dr. Kalegi has new information about his patient who's in respiratory distress.
When the nurse was putting in a catheter, she noticed something. It was a penis. This woman, who had curvaceous hips and chest, appeared to have male genitalia.
Doc, second ambulance just came. You're not going to believe this.
Suddenly, another patient with difficulty breathing came in.
You think her name is Jamie?
Also like the first lady, she was in extreme respiratory distress.
Hey, I'm Dr. Kalegi. Can you hear me? I need you to respond if you can hear me. If you can hear me, just blink your eyes.
Seeing one patient like this, who can't breathe on their own with no obvious cause, is extremely rare. To see two within literally minutes of each other is unbelievably unlikely.
Same drill as before. Let's intubator, get a chest x-ray.
She was even in more distress than the first patient. She was tiring out quickly, so like the first patient, we had to very quickly intubate her, put her on a ventilator, and stabilize her so that she could breathe. I proceed to examine the second patient, and once again, find that she has male genitalia. I've treated many transgender patients before, but I never had patients that seem to have curvaceous chest and hips, but male genitalia.
Must be hormones, right? I've never seen that drastic a change with hormones alone.
The only time I've seen that is when it's been genetic, and those are extremely rare.
Plastic surgery then? There's no scarring.
I knew these two women had to be linked somehow. What I wasn't sure of was what the link was. I went out to the waiting room to see if either of the patients had any family or friends there, so I could better understand their medical history and what they were doing that night to figure out what might have contributed to this. I noticed a group of elegantly dressed women appearing very similar to the two patients I had just taken care of.
Excuse me, ladies? Are you here for anyone in particular? Our friends Kelly and Jamie? Are you their doctor, or are they okay? Can we go talk in private?
Now I'm hoping I can figure out what they were doing that night, and if that may have contributed to whatever caused their difficulty breathing.
We stabilized their breathing, but we're having a lot of trouble figuring out what's going on. I was hoping you could shed some light on what happened tonight. Well, we were at a hotel together, all of us, and, getting ready to go out, girls' night. And then Kelly started having trouble breathing, so we called an ambulance, and then Jamie went down. Did they eat anything unusual or do anything out of the ordinary? No,
started looking at her friends. They all started looking down. Finally, the one woman looked back at her friends, and there seemed to be some nods among them. And she turned back to me and said, "We were at a pumping party? A pumping party? Pumping party?"
When the world gave them setbacks, science gave them bounce back. And when your vet delivered life-altering news, science delivered life-changing nutrition. Hill's Prescription Diet. Science does more. Look at it go! Women's Sports Network highlights I want people at home to feel like they're right here with us.
Women's Wear helps expand the mind of the viewer.
In the atmosphere that we deserve.
You're watching the Women's Sports Network.
Women's Sports Network.
Women's Sports Network.
Step inside Stingray Cozy Cafe, where inviting coffee house scenes meet down-tempo lo-fi beats. Tune in to Stingray Cozy Cafe and savor the vibes.
You don't need to be a movie buff to love Cinevault classics. You just need to love movies. Yeah, that's the best part of it. Cinevault classics.
For a little county hospital, it's in the middle of the night. He has one little IV, and I just thought, this man's gonna die.
Emergency nurse Terry Foster has just discovered that the incision in his patient's neck is ruptured.
Move, please. I saw blood squirting out of his neck, probably 2 feet in the air. This was unbelievable to see. So I immediately put my hand right on his neck. Go get the doc. Okay. Apparently, while he was vomiting, his carotid artery grabbed, ruptured, and blew his incision wide open. Blood was all over the room. It was on the walls, it was on his wife, it was on the patient, and now it was on me.
Dickinson's coming.
Okay, get some O2 on him. Fast, full blast.
His IV's gone. Just lost the IV.
It was awful. It was just the most awful thing to see. Look for a vein there and get another line in him right away. Where was the
I
doc?
don't see one. I don't see me.
Okay, keep trying. I need a doc in 3. Now! We're a little county hospital. It's in the middle of the night. He has one little IV, and I just thought, this man's gonna die.
I'm Dr. Tinsley.
When he was vomiting, he blew his graft open. I'm holding
Who's the surgeon that worked on your husband yesterday? Dr. Speck. Okay, I'll call him, see if we can get him in here. We just have to keep him stable till we can get another surgeon.
I'm trying.
And lower his head, his BP's dropping.
Okay, lower it fast, please. When a person's going into shock and their blood pressure's dropping, you want to put their head down so that you can get more blood flow to the brain. Patrick? Okay, Patrick.
We've got to get him to Mercy's staff. They've got a team standing by in the alarm.
Mercy, that's a 2-hour drive. In the storm, he's got a hole in his neck.
You're right. Medevac?
I doubt if they fly tonight in this storm.
Let's find out. I'm on it.
Patrick, hang in there, buddy. I'm here with you. As I looked at this man, he just had a terrified look in his eyes. And I remember thinking, I'm one of the last people, besides his wife, that he's going to see before he dies.
I'm kind of freaking out here. He's going to be okay, right?
Yes, I'm right here with you.
wake back up and be a little bit more alert. But then he would have more bleeding from his neck. Then when we would put his head up, he would have less bleeding, but then he would become unresponsive. So we were going back and forth, putting his head up and down, depending on his symptoms.
I've been trying to arrange an air ambulance to transport your husband to Mercy Hospital, but unfortunately they're grounded because of the storm.
We couldn't just put this man in an ambulance and send him to another hospital. He was way too unstable, and obviously the hospital was a ways away, and we were going through this terrible storm as well.
So what now? Well, we'll have to call in our vascular surgeon, and he can take care of him right here.
Doc, we don't have a vascular surgeon that comes to this hospital.
How about you just rest on the bed?
Dr. Aaron Billings' patient was brought into the ER by the local sheriff after reporting stolen coins and then passing out.
No, I'm leaving. I ain't leaving her.
You okay?
As a retired cowboy, these guys are tough. And when they connect, you really feel it. Amy, we're going to need a lasso.
Got it.
We didn't want him to do that again, so he needed soft restraints on this time.
Betsy's out there. She ain't probate.
Easy now. Just have a seat. Have a seat. You're going to be okay. We'll take care of him. He was terribly confused. Since we don't know what the patient's fault at this point, it's urgent that we do a complete evaluation and find out what's going on with this gentleman. About this time, he calmed down enough that the nurse was able to get some vital signs.
BP's 130 over 88.
Gail, get a CBC, CMP, and alcohol level and talk to me. Amy, would you get an EKG and schedule a head CT, please?
Sure thing, Doc.
No. We've got all these lab tests back. Just a little atrophy on his head CT, but that's normal for his age. And the EKG is normal. No drugs or alcohol in the system. Look at his BUN and creatinine. Most everything was well, except for his BUN and creatinine, which indicated that he had some degree of kidney failure. The patient is confused. He can't give us a history. We know absolutely nothing about his past or the medications he takes. We don't know if this kidney failure is new or is old.
Like broomtails.
And possibly it has something to do with his confused.
Like, say, yeah. Look, we can't.
Hey, Doc, his BP's 20 points higher in his right arm than in his left.
That's highly unusual.
It's not good. Can't let that happen.
I need to get a look at his heart. Something's not right with his circulation. That, of course, raises the possibility of a dissecting thoracic aorta, which is an absolute emergency.
Would that explain the malaria?
No, actually. Something's not adding up here. But if he's got an aortic dissection, he'll need emergency surgery. The best way to decide whether or not he had a dissecting thoracic aorta was to do a CT scan with IV contrast.
Don't like that. One bit.
Imagine how all those rodeo broncs feel.
Unfortunately, his kidney failure would not tolerate the use of the IV contrast needed for this procedure. So our next best test was a chest x-ray to look at the shadow cast by the great vessels of the heart. Easy, man. We're just going to take an x-ray for chest.
Doggies, they bury windpipes.
I'm sure they do. You just hold still. We'll get this done.
Don't let them.
Now the chest x-ray looks for the shadow cast by the great vessels of the chest. And if he has a dissecting thoracic aorta, usually the shadow will be wider than normal. And that would be our first clue.
Don't let them.
X-ray's up.
We pulled up the x-ray on the video monitor and saw no evidence whatsoever. Let me take a closer look. But curiously enough, we saw something that we totally didn't expect. No closer. Dr. Galante is running out of time to solve the mystery of two critically ill patients who can't breathe.
I really need you to tell me. This is life and death stuff. Have you ever heard of a pumping party? Pumping party. Call me naive, but you'll have to explain it to
know this occurred. We did really a forward surgery, and it's faster than hormones. We look hot. Although you do have to sleep on your side for a few days. It hurts like hell.
So you're saying you're all...
Boys down below. Not here, nor here.
And you all received the same injections?
Yeah.
And none of you have had a reaction?
We're fine.
So there must have been something different about what Jane and Kelly received.
You can say that. They were creepy, that's for sure. This is when she told me that these two women, my patients, had received far more of the material than the rest of them did. By the time the guy got to us, he was already on the second gallon. I can't imagine injecting 2 gallons of anything anywhere. We told them to stop, but they wouldn't. And Kelly's got this modeling job next week, so she wanted to really look good. They're gonna be okay, right?
We'll do everything we can.
Because these patients were on a ventilator, I called our ICU doctor and asked him to come to the ER.
Too unstable to put through a scan. That silicone doesn't show up on an x-ray. The only problem is if we try and clear it from their lungs, there's still some under their skin. It'll be a losing battle.
Suddenly, the first patient was in a lot of trouble.
Tube's clogged. I need suction.
When the patient is intubated, that tube is their lifeline. And if that tube gets clogged,
It's not working.
we have a serious problem on our hands.
Keep trying. I just kept thinking, this man is bleeding out. We have got to get an IV.
There's nothing.
Dr. Kalegi's patient has an intubation tube that's become clogged with silicone, the result of illegal injections.
We'll have to sedate or more. Give me 4 we're safe.
When the patient is intubated, that tube is their lifeline.
We'll have to replace it too.
And if that tube gets clogged, we have a serious problem on our hands. A life-threatening problem.
What is that? It's silicone. They've been getting it injected and it's traveled to their lungs, the tube. A doctor would do this to them. Not a doctor, just some butcher in a hotel room.
We can't afford to have that tube clogged up again. We were worried that they could still have a huge depot of material under their skin, seeping into their lungs.
What can we do if we can't see it on x-ray?
That's only going to make their breathing worse, and they might not ever be able to recover. We tried to figure out, how can we determine right there in the ER if there's any material still under their skin?
An ultrasound. Why not?
What are those?
Let me take a closer look. Dr. Billen has discovered 2 unusual objects on the x-ray of a patient with a potential heart problem.
As we studied the x-ray, we noticed some foreign bodies that shouldn't have been there. One was overlying his esophagus and his airway, that's about halfway down to his stomach. The other was at the level of his vocal cords. At that point, I thought to myself, could these be the missing coins? The coins that he went to the sheriff's office to report stolen.
This one here is in bigger danger, and you didn't get it out right away. Call an RT, let's move it, John.
Okay. Hey, I need an RT. Stop.
It's sitting in what's called the piriform recess, just above the vocal cords. And at any time, this could fall into his airway, causing disastrous results.
Why? What's that?
Gail, 20 milligrams of etomidate, 100 milligrams of INS-6, please.
Holes in the pockets.
Well, at this point, we really started to scratch our heads. Are these apparent coins that cause this problem?
Good.
Do they have absolutely nothing to do with this problem? Why his mental status has changed? We really felt like we were being challenged at this point.
Damn. Holes. Where's my money?
Let's push the etomidate.
You got my money?
We give the patient medication in his IV,
20 milligrams of etomidate in form.
putting him asleep temporarily, and now push the sucks. And also a neuromuscular blocker, which paralyzes him temporarily.
100 milligrams of succinate.
Okay, let's bag him a few times. And while this is happening, we have to breathe for him. Okay, that's good. Let's go find that object. Okay, come on. It's gotta be here somewhere. Can't quite visualize the object. Come on, Hank. All I could see was a big mass of secretions, and I didn't see any coin. Come on. Come on. But I knew from the location on the x-ray that it should be on his left
APU to pinpoint the location for you. Yeah, thanks, Ron. So before sending him to the operating room, have the endoscopist look down at the scope and remove it.
One more X-ray, Hank.
He decided to get another chest X-ray.
Wrong way on your nose.
Hey, Doc. Yeah. That penny you pulled out of Hank goes for about 85,000, depending on its condition.
That's incredible.
Want to join the pool on how much the point of his esophagus is worth?
I am.
2,000 pennies?
It was 1943 copper weekday.
Doc? X-rays up.
We repeated another chest X-ray to check on the position of the coin that was in his esophagus. Lo and behold, the coin in his esophagus is now gone, which was a great concern.
Nurse Terry Foster's patient is losing blood fast and running out of time, and there's no surgeon on call.
Don't worry, Rebecca. We'll make some calls.
They need you in the trauma bay.
Okay.
Hey, do me a favor. Get Dr. Gordon on the phone and ask him to come in.
But Dr. Gordon will retire today.
I know he retired. Just get him on the phone and tell him I need him now. At this hospital, we get kind of an old country surgeon who had recently retired, but he had not been replaced yet. But I thought, you know what, let's call him. What have we got to lose? Maybe he will come in and help us. Keep trying. I just kept thinking, this man is bleeding out. We have got to get an IV.
There's nothing.
Okay, you gotta keep trying.
Oh my God, he's passed out.
It's all right. I still got heart rate.
Sweetie, wake up.
Don't slap him. Don't slap him. It's gonna make him bleed more. Put his head down, please. Don't slap him. I was trying to remain calm and keep his wife calm, but he kept passing out. He kept losing consciousness, and his blood pressure kept dropping. I'm right here with you. Just gotta get his blood pressure back up, okay? That's what we're trying with the IV there. So finally, I do what I do a lot of times. I just started praying to myself, and I just thought, dear God, please find me the vein.
Terry?
What? This huge vein popped up on his arm that was not there before. Where did that come from?
I have no idea.
This vein went from his wrist up to his elbow. Divine intervention. Put an 18 in that. Usually God does that, so my prayers are quickly that they don't take it. Good work. You need to get his blood pressure up, all right?
Terry, is my husband going to die?
That is a very awkward move because I don't want to give her false hope. I'm certainly not going to lie to her. And I just felt like I'm going to tell her the truth. We're going to do everything we can for him. I think there's a real good possibility that something could happen and that he may not make it. We're going to try everything we can. And this was very hard for me to say because I was kind of in the same position. At that time, my wife was very ill, and I didn't know really if she was going to survive her illness or not. If there was ever anything that you wanted to say to him, you need to say it to him now because you may never get another chance to tell him. I didn't want to tell her that he would live if I didn't think he would live, and I didn't think he would live. That's the time to just take a minute just to say what you always wanted to say to somebody. And a lot of people don't get that chance.
I'm here. I'm here, and I love you.
I wanted to give that privacy as she was telling him goodbye. I obviously couldn't take my hand off of his neck.
You have to go. I want you to know that I'll be okay. I want you to know that you're my best friend, and you always will be. Put that in your heart, and you take it with you, okay?
human. Where's yours?
Did you hear that?
It's our job. You. Where others won't.
Fear Factor's back, and it's crazier than ever.
Definitely do with another pair of hands. I'm on my way. Every week you give the children a chore to do.
He's done so much to change our family.
Thank you, Jojo.
Dr. Pileggi's patients may still have toxic silicone trapped under their skin. He needs to find out fast.
If they had gotten so much silicone injected, they still might have a lot under the skin, and it could be continuing to flow into the bloodstream and into the lungs.
An ultrasound. Why not?
Ultrasounds can identify fluids. Well, why don't we do an ultrasound?
Ultrasound what? Their buttocks and hips and chest? I'm not so sure.
The ICU doctor seemed reluctant at first, as it was such an unusual use of ultrasound. But once he thought about it and realized what we were looking for, he thought it was a great idea. This was an unusual idea because we don't usually do it for these purposes. We do it to look for other issues. But ultrasound can find fluid.
We good?
One down, one to go. We performed the ultrasound and fortunately did not find any further fluid under the skin. But we weren't comfortable transferring them away from the emergency department. So once we knew that, and that no further material was seeping into their bloodstream, we kept them on the ventilators, applying lots of pressure to try to force the material out. Their lungs slowly, eventually recovered. So we found out that this person who performed the injections had been traveling up and down the coast doing these various pumping parties. And in fact, these weren't the only two women to get sick from that. The police were looking for this person and eventually found him.
He was arrested and put in jail. As for my two patients, they got back to normal. Oh, caught red-handed. Dr. Pileggi, our hero. Just coming in to check on you.
Oh, how sweet of you.
We meet the news. Or at least the bastard who injected us dead. You could have died. Any of you. It can't happen again. Nothing is worth that. On this, we're done with it. Well, good luck, ladies.
Group hug.
In terms of my life as an ER doctor,
I realized that I had already seen a lot, and I would continue to see a lot more, and I should be prepared for anything, and never even assume something as simple as that someone's a man or a woman.
More X-ray, Hank.
Two holes. That's where all my money goes.
Dr. Billman has removed a penny from his patient's throat,
I don't see anything.
preventing an airway disaster.
You just lost a very expensive thing.
Watch those goats. They got boots.
After we removed the coin above his larynx, and he was allowed to wake up, he was still confused.
His blood pressure's equal on both sides, but it's still high.
Great. Now we just need to figure out why. We had a mystery on our hands. Why was his blood pressure different when he presented emergency room? Why did this go away as soon as we moved the coin from his larynx? Annie, would you call the sheriff and let him know that we found those two other coins that Hank reported stolen?
Sure thing.
And we're going to need another x-ray to find out where that other coin is.
Yep, I'm on it.
The other coin was a great concern.
Under my list.
Doctor, blood pressure's shooting up.
Notes.
Within moments, the blood pressure began to rise.
180. 190.
Metoprolol,
5 milligrams IV.
got it at 200.
5 milligrams metoprolol.
Give him labetalol, 20 milligrams IV.
Got it. Labetalol, 20 milligrams.
And that still did not make his blood pressure go. It finally peaked at 225. Biggest risk in a situation like this is a stroke.
Doctor.
Stroke.
Terry Foster has just watched his patient's wife say her final goodbye to her husband.
Dr. Gordon's coming in.
Oh, thank God.
Thank you.
So they called this retired vascular surgeon. He answered the phone on the first ring. He said, I will be right up there, get the OR set up and ready, and call the crew in.
We're calling in the OR team. We'll get your husband into surgery right away. Make sure you're up.
Okay.
Who's gonna do that?
I'm going to prep the OR room. I haven't done it in 20 years, but I can do it. Meanwhile, you're going to hold pressure on his neck. Come on over, Linda. I need your help. I need to go prep the OR room, okay? You got your gloves on? Okay, all right. Can you get your hand up here? Count at 3. 1, 2, 3. Okay, good job. Okay, I'll be right back. It had been a long time since I had set up an operating room, since nursing school. So I thought, I'm going to give it my best shot. And I went in there and I was setting up the Mayo table and the stand and everything. And I thought, well, thank God all that beer didn't wash out my memory in nursing school. This guy was really fading fast. I mean, his blood pressure was at rock bottom. His heart rate was sky high. It was looking really bad. Okay, surgery's ready. How's he doing?
BP's down, heart rate's up.
Okay, let's go ahead and go. All right, Patrick, we're going to get you up to surgery, buddy. Hang in there. You got you holding on to his neck. Okay, all right, thanks. So we're going to the ER to get to the operating room. And all the people who have been waiting, I think that made them understand why they were waiting. There's a surgery waiting room down the hall. Can I show you where it's at?
I need to smoke.
Well, we have a smoking area. You want me to show you where it's at? Okay, I'll go with you. Normally, I would never leave the ER, but I felt like I needed to be with her a little bit and give her some emotional support. Rebecca, I know exactly what you're going through. My wife's been very critically ill for a while.
I'm sorry.
She's been in and out of ICU a couple times. Maybe it just helps you. Somebody knows exactly how you feel. And I do. I felt like by sharing the experience with her, she would know that I completely understood and that she wasn't going to be going through this alone.
How many kids?
We've got a daughter. How about you?
Same.
How old?
5.
3. I guess we just ended up comforting each other. Before my shift ended, I stopped by the OR to see how things were going, and it was eerily quiet in there. I thought for sure that this guy didn't make it. And then I looked and I saw his wife, and I thought she probably doesn't even know yet, and I'm afraid I'm going to have to be the one to tell her. Come on, Hank. Come on. Started some medicine.
Doctor?
So we brought out the big guns at that point.
ER nurse Terry Foster is afraid he'll have to give the wife of a patient the worst possible news.
Did anybody talk to you yet? At all? Okay. Hi, Dr. Gordon. This is Rebecca.
Hi, Rebecca.
How's he doing?
Very well. Very well. The graft took. He's going to be just fine.
Oh, my God. Oh, God.
He's in the recovery room. Would you like to see him?
Oh, my God, sweetie. I'm so happy for you. I just couldn't believe it. I thought for sure that guy would die on the table. I was dumbfounded. Listen, I played hooky long enough from the emergency room. I probably better get back, okay?
Amazingly, he lived. It really was incredible. I just never thought that this man would have survived this.
I have been in a lot of hospitals in my life, and no one has ever been as kind to me as you.
It's okay. I'm just so glad I could be there. Go see your husband.
You'd like to see him?
Sometimes you can take your own pain and your own heartache and channel it into helping somebody else. And that was the situation on this night. And that's just one night I will never forget.
See you, Jack.
20 milligrams IV. Got it.
And the blood pressure of Dr. Billen's coin collector patient is dangerously high.
We started some medicine that had no effect. Come on, Hank. Come on. Makes you worry about an stroke.
225. Doctor?
So we brought out the big guns at that point. Medicine usually saved only the most urgent cases. And Gail, start a nitroprusside drip in a quarter mic and titrate to effect. It's saved for last because it has side effects, mostly variations in blood pressure, allergic reactions, and has to be carefully monitored. Good sign. Really good sign. And his blood pressure continued to come down.
Where in the blazes am I?
You're in the hospital. I'm Dr. Billen.
Where's the sheriff?
Well, the sheriff had to step out. But we did find your coin that you gave missing.
There was two of them.
Well, we have reason to believe you're going to be seeing the other one soon. Very soon.
Oh, she doggone.
He was experiencing hypertensive encephalopathy. This is a condition where high blood pressure in the vessels around the brain causes these vessels to lose their ability to regulate the blood pressure. They constrict even more, raise the blood pressure even higher. And what you get is dysfunction of the brain, altered mental status, confusion. So we took another chest x-ray further down in his abdomen. There it is. Now that it's passed into the stomach, it'll pass through the GI tract without any complications. But this is a coin he's going to have to retrieve on his own at some other time. Hopefully a situation like this can be avoided in the future if he keeps his blood pressure under good control.
How's he doing?
Much better. We're taking him down to the ICU now, but he's well on his way to recovery. We never did find out why he had a difference in his blood pressure, but obviously he had some type of circulatory problem that caused us to look at his chest, caused us to find those coins. But as is the case in medicine many times, we may never know what that circulatory problem was.
How did swallowing these coins cause Hank to lose his marbles?
Turns out it was the other way around. His blood pressure rose, he developed hypertensive encephalopathy. He got confused, swallowed his coins, thought they'd been stolen, made a report to the sheriff, and that's how this whole situation started.
Thanks, Doctor.
Anytime, Sheriff. So now, the mystery was solved. Next cowboy?
Cowgirl. I think she broke her ankle last week.
Tough crowd.
Giddy up.
These are the stories of the ER doctors never talk about.
This gentleman needs a central line to get medicines into him quickly.
Step back, we're going to have to shut this guy.
Neil, I can't step back and hold on to the wire.
Let it go. Why let go of that wire? If it's stuck in that person's heart.
Take that tube out of your nose, you should die.
This is one of the most painful and uncomfortable procedures. Cutting off all the blood to her lower body. The chance of living is probably only 10%.
These are the ones I'll never forget.
It's only a matter of seconds.
And then you realize
This person
lives or dies.
because of me. These are real stories.
Told by the real doctors who lived them.
I think Dr. Ravi Kamat uses the philosophy he learned as a boy in India for his practice as a trauma surgeon in a busy American ER.
God has given us this body for service and sacrifice. Make sure that whatever living you have, you can share it with somebody else and make their life better for them as the service free.
Two cousins sitting in the car, they're both shot. This one's 33, he's the driver. Both will got shot once to the torso. They got a patent airway, breathing adequate rate, ton of volume. His pulse, blood pressure, both stable.
33-year-old Marquis Young had been running with the wrong crowd. He was sitting in the car with his cousin when they were both shot at close range.
1, 2, 3.
Now, I'm very, very concerned about it. When the bullet goes across just from one side to the other side, it could have damaged some very vital structures.
Lay down, put your legs down.
Let's roll it over.
Okay, I got nothing back here, no hole.
Looks like five total. No entry wounds at all, bleeding out. Could only internal. We try to identify where the gunshot wounds are, and there is no bleeding. All the more worrisome, because it means he may be bleeding inside. Where's the other man?
He's viral scene.
He did not realize at that point that he was paralyzed from his waist up.
1, 2, 3. Right.
The really needs to know what the extent of his injuries are and take him for a CAT scan. Let's go, come on.
Outside in the waiting room, Marquis' mother and wife Ada arrived.
My husband's been shot in the spot here, and his son, my baby.
And the nurse is looking at me and she tells me, well, we just brought someone in when he passed away, and I'm looking at the nurse like he's got to be kidding me.
Mark, you? Yes. Oh my God, I'm so sorry. I'm so sorry. He's in trauma. Come and follow me.
Experience for you guys. See how it's all filled up now? Then twist this like this. Whoa, now watch this. So you literally transform the toy in this machine before you get it. Take the lid off and reveal your brand new action.
hands down so I don't want to have myself time. Going hands down so I don't want to leave my old job. Heading on up south so I'm going to see if I can go wine. Come on down south so I can meet some friends of mine.
Waiting for Christmas. Time to dash it. Eric, you're just going to have to be patient.
Principal Victoria, it is wrong. It is wrong, and I simply will not do it. I care about my students, and I will not fill their heads with lies. I am not teaching evolution in my class.
Listen, Eric, evolution is in the school curriculum. We have to teach it.
Evolution is a theory, a harebrained theory that says I'm a monkey. I'm not a monkey. I'm a woman.
home right now. Can I just stay a little longer? It's almost bedtime. If you sleep in, time will go by faster.
Principal Victoria, we are a devout Catholic family. Do you mind telling me why my daughter now thinks she's a retarded fish frog? I told you this would happen, didn't I?
Mr. Triscotti, I wasn't aware.
We have worked years to instill the teachings of Jesus Christ into our daughter, and with one fell swoop, you tried to destroy everything we did. I hear you.
Sir, if you don't wish your daughter to learn about evolution, then we can pull her out of class.
You most certainly will.
Yeah, I want to learn everything.
No, you don't. Shut up. Well, I told you, we should leave evolution out of the classroom.
It has become obvious to me that you don't know enough about evolution to teach us. I'm having you replaced. Mr. Dawkins.
Replaced?
Richard Dawkins is a world-renowned evolutionary scientist.
Charmed to meet you, Ms.
Shut up, faggot. Principal Victoria, I can teach my own class.
You are to sit in class and help Mr. Dawkins with whatever he needs.
Over billions of years, life has evolved from simple one-celled organisms into all the complex life we see around us.
Whatever.
It was changes in hereditary traits that allowed the first mammals to breathe in the air.
Retarded fish frog.
Miss Garrison, I believe that's a gross oversimplification.
Well, you're a faggot. Continue.
You see, children, life has the amazing ability to change, to adapt, like changing us to the point that we walk upright.
So you are saying that we're all related to monkeys?
Well, yes, basically we are.
You see monkeys at the zoo? They crap in their hands and throw it at people.
Miss Garrison, this isn't theory. It is scientific fact.
What about the fact if I believe in this crap, you're going to go to hell? Doesn't that bother you a little?
Actually, no, because I'm an atheist.
Aha! I got you, you snake in the grass! I found you out!
I never covered it up.
And if I'm a monkey, then I might as well act like a monkey, huh? What on earth are you doing? Don't ask me! I'm a fucking monkey! Ah!
Principal Victoria, I was simply trying to make a point to Mr. Dawkins about the incongruity of some scientific statements.
Mrs. Garrison, I am pulling you out of the classroom.
What?
Principal Victoria, I really don't think that's necessary.
This woman is very opinionated, but she does care about her students.
Very well. But there is to be no understood?
Miss Garrison, could I have a word with you, please?
What?
Look, I know you think we are at war, but I want you to know, I admire your passion.
You do?
I've never met a woman with so much fire.
Well, I do bring down the woman's wrath now and again.
So much boldness in a woman.
I'm sorry, I'm sure you have a husband, but I...
No, my husband is dead.
Would you then consider having dinner with me tonight?
Well, I suppose we could have a little steak or something. I've got a date! I've got a date! My first real date with a real man since my sex change operation. Oh boy, what'll I wear? Hey everybody!
It's almost like you're one of the guys.
Yeah, almost. You have so much spunk, so much life. Who are you an atheist?
Well, you know, I'm open to stuff. Why is someone as outspoken
We have a pulse.
Can you understand me?
Where am I?
My name is Schmidt. You are safe.
Hey, where, butthole?
My friend, this is going to be a bit of a shock, but it is the year 2546.
What?
You have been frozen in ice for over 500 years.
Alright. Alright, you black asshole!
Please be careful. I'm afraid.
Is the Wii up? Where's the Wii?
Nintendo Wii. A primitive gaming device used in his time.
Primitive. It has motion control controllers, asswipe.
Young man, you don't seem to understand. Your family, your friends, everyone you knew has been dead for over 500 years.
I don't care. Is there a Nintendo Wii?
We don't play video games in our time. There's no such thing as a Nintendo Wii.
No.
You must understand, children, that we are dealing with very large numbers here.
That's my man.
So, evolution doesn't even happen by chance. It is, in fact, bound to happen. That's right, kid. And so you see, there is no God. Careful, darling. The school board doesn't like it when we...
Well, there can still be a God.
What?
Couldn't evolution be the answer to how, not the answer to why?
Uh-oh, retard alert! Retard alert, class! Do you believe in a black spaghetti monster too, level-head?
I wasn't talking about spaghetti.
Come on, you. You're gonna have to sit in the dunce chair. Miss Garrison, I'm not so sure what you did in class today was right. What? What did? You told me that the world would be a better place without religion. Yes,
woman with such balls.
You've just been too soft on religious people in the past. Think about it, Richard. With your intellect and my balls, we can change the future of the world.
Can you imagine a world with no religion? No Muslims killing Jews, no Christians funding abortion clinics. The world would be a wonderful place. Without God.
You're the smartest man on earth, Dave. With me by your side, there's no stopping you.
Oh, just let me see those beautiful breasts again.
Oh, all right.
Oh, yeah, baby. Oh, yeah.
Quick, little Vigilante! Kill those superheroes! Pew, pew, pew! Yes! Now the world shall feel the wrath of Professor Tails!
Butters? Butters, you haven't seen Eric Cartman in the past few days, have you?
Hello, man.
It's very important, Butters. He's missing. You haven't seen or heard from him?
No, man.
Okay.
My Professor Tails has destroyed his anthill. Hey, gentlemen, let's ask you a scientific question. Okay. Well, can anything bad happen if you completely freeze yourself and then unfreeze yourself 3 weeks later? Yeah. Like what? Die? Well, yeah. You freeze your body, makes you die. When you wake up 3 weeks later, you can be unfrozen, but you're still dead. Oh, Hammerman! You just left him here? Without a jacket or anything? He told me to. He's dead for sure. Wait. It's so different. Nothing in the same place. Oh, my God. Eric! Eric! Butters! Have to get out of here. Nobody's ever going to find his body. His gut has never say anything about this. You understand? He's dead. And if they know you had hands in it, you'll go to jail. But I just did what he told me. Come on, we have to leave. Oh, goodness gracious. Terrible. 500 years in the future.
Eric, I have good news for you. We may have found you a Nintendo Wii.
What? Really? Yay! Yay!
It's good. There's one at the Museum of Technology in New Hampshire.
Not naturally. Come on, let's go.
Well, there's something we need from you first. You see, my young friend, you were unfrozen for a reason. Lots of people froze themselves in cryogenic labs, and we don't have reason. But you are special.
I know I'm special. This isn't news to me.
You lived in a time when a great event happened, a glorious event that finally made all religion obsolete. Now, the entire world is atheist.
And this gets me a Nintendo Wii how?
We believe that somebody you knew in your time was the person who first started our wonderful group, the Unified Atheist League.
Who?
What is science to say with that? Oh no! It's the United Atheist Alliance! Oh, science, help us! Science, damn you, Unified Atheist League!
Who are they?
The Alliance Atheists! We're at war with them! No!
It's right.
You believe in a supernatural being? Oh, my silence.
I'm just a little boy from the past who wants to play Nintendo Wii.
Put me through to the Allied Atheist Allegiance. On the screen. Look, Allied Atheist Allegiance. We have the Time Child.
Science, damn you, United Atheist Alliance.
Now you see, foolish sea otters, that we are the atheists in control.
It won't make a difference. This is the dawning of the sea otter. Know this, my child. I shall smash your skull like a clam on my tummy.
aware of the people around you.
So who is this guy? Nobody knows. It's like a ghost.
Somebody was bound to get hurt.
we have to be super duper sure that nobody finds out we're doing it. The United Atheist Alliance is about to send out all its defense to take down the Allied Atheist Alliance's landfill. Raise science. This is your chance, Yunsuke, to avenge your father's death. Careful, son. Just because their science leads them to a different answer to the great question doesn't mean we have the right to kill them all. No. Our answer to the great question is the only logical one. Our science
And I'm gonna show them the video. So it actually did start getting a little better. But my SSDI appointment came up. Well, then my body started going haywire again. So I'm gonna notate this video in the morning. Appreciate that. This is the reason why I'm getting SSDI. So it has to go away, not elevate. In order for them to just frequent. Good night. Damn it. This is if you hear me talking to myself, it's therapeutic. I can't be medicated, and I have several psychiatric disorders, so this fucked up shit exacerbates my psychiatric disorders. You can talk to Cedar Recovery, the Mental Health Co-op, and soon Centerstone about these issues, and Vanderbilt, that I can't be medicated for. So I do daily therapy, and about to be twice a day to compensate because they can't medicate me for it, which is another reason why my SSDI will be approved. Because nothing works. I can't even sleep like a normal dude. I'm going to show SSDI every single video so they can see the progression. They can also see how it started to get a little better. I didn't sleep every night. I didn't sleep all through the night, but I was falling asleep. Got at least 20 minutes of sleep. But the day or two before I had their appointment, it flared back up. And it's not getting no better. It's an everyday staple, which is why I'll be a Vanderbilt patient for years until they figure it out. On my SSDI gets approved. As long as I'm on the medical leave of absence, Hardee's has to keep me as an employee. I don't care if it takes 10 years. So Donald Trump can't touch my health care because I'm not working. Because I'm considered an employee. That's all you need is a job. If they do take me off their roster, I'll lose my health care. I can sue the shit out of Hardee's Corporation. It's illegal to fire someone while out on a medical leave of absence, especially if their doctors have not cleared them to come back yet. And this is why none of my doctors would clear me to do anything, because I can't close my eyes and just pass out at night and wake up to be a normal person. It don't happen. And SSDI will get every single video that I've recorded. And I'm going to continue recording every night until my life recovers back to its God-given state of being. How do you think? I'm the only one that understands what I'm going through. It's been classified by Vanderbilt, Moimito, Dr. Ryder, CEO, as soon as every doctor that's looked at it as unique, rare, individual, first of its kind, never seen before, unheard of. But they know it's real, they know it's happening, especially because I'm recording it every night. So I'm the only one that understands exactly what I'm going through, even though my family witnesses it daily for a year straight. My doctors know what I'm going through. I'm the only one that fully understands it, so I like to conversate with myself too. Because I know what I'm talking about. I feel like sometimes I need to release it and so much I'm going through. So I say it to myself. Plus I have auditory hallucinations because I don't sleep ever. And expect that there be a psychosis going on. And my doctor has diagnosed me with PTSD, anger management, a bunch of other stuff because of this fucked up sleep and energy deprivation shit. So I hear shit. Head ringing 24/7. music played on a loop. Like I'm losing my fucking mind because I can't sleep anymore. Like God allows me to sleep. My body burns up every day, all day. I can't breathe fresh air. My eyes are gunky and sticky, all day, every day, burning. Withdrawal symptoms 24/7. And I take 2 of these bad boys every day. For 10 years now. I haven't touched an opioid in 10 years. But since none of my medications are responding and they're rejecting, I now experience opioid withdrawal 24/7. And that's a fucked up feeling for a recovering opioid addict of 10 years who hasn't touched the stuff in 10 years to feel opioid withdrawals on a regular basis. When I'm talking to my demons, my devils, where I feel like God is trying to save me, but the devil keeps attacking me. So when I tell him, if you left me alone, that wouldn't happen, this wouldn't happen. I'm talking to the devil that's attacking me. So I like to label as Raphael. Like I have my devil in the name. He's also from Baton Rouge, Louisiana.
Their observations of O'Reilly in the lead-up to the funeral had been playing on their minds.
I was down in their house and we were talking about things, and they said, oh yeah, and Joe was here, sure, he didn't care about Rachel, and we had to tell him to write that note, like, you know. And the detective that was with me, Detective Peter McCoy, the two of us looked around at each other, because we thought the same thing. What did he write in the note, you know? And could it be a confession there or anything like?
With the Kalali family's blessing, detectives made the difficult decision to exhume Rachel's body. They were certain that O'Reilly's note inside her coffin could be the key to unlock the case.
It's a 5-page letter. In he said it's the hardest letter I've ever had to write in my life. He asked for forgiveness. And he said, it'll haunt me for the rest of my life. And I hope you forgive me, Rachel.
It's further evidence that Joe O'Reilly is not innocent of the crime of murdering his wife. But at this point, there still isn't enough evidence.
Right.
He was saying